some examiners actually may not like the fact that you say delusional disorder in less than 8 minutes. You are FY2. You're not supposed to diagnose a disorder in 8 minutes. It's like delusional disorder, and it's usually diagnosis of exclusion, delusional disorder. Some other academies claim that the patient does not have any other symptoms apart from delusions, and they are here for 3 months, and they have affected the patient's lives. So it's definitely a disorder right now. It's definitely a disorder, and it is pure delusions. What I do recommend that you say psychosis. Though I was taught in my academy that you should say delusional disorder, and it is the right thing, by the way, to say delusional disorder, and it's definitely delusional disorder. But I do recommend that you say psychosis. Why? Because to diagnose a psychiatric condition, you need detailed psychiatric history and collateral history and such things, and detailed risk assessment. So what you are going to do, you are going to say psychosis. It is a condition in which there is some beliefs or some firm shaped beliefs which the patient or which the person is having, and I'm sorry, they are different from what's real. So they are false beliefs. Okay, false beliefs, false imagined beliefs different from what's real. He will tell you, I don't think it's the case, doctor. Don't argue with him. Why you should not argue with him in this case? Dr. Elvira, you think, if he tells you, doctor, I don't think it's right, what are you going to say here?
You mean he says that you are not right, yeah?
Yeah, he will tell you, doctor, I don't think it's the case with me. What are you going to say?
I said, I'll probably say, we will get a second opinion, no?
No, don't say this. I will tell you what to say. Usually, a very good point is that this guy is lacking insight. Throughout the station, you know that he already does not have any insight, which means that he is not able to recognize that he has a problem. So if he asks you this question, I don't think it's the case with me. Definitely, that's normal because he doesn't have any insight. So he assumed that what he's thinking is right. So please, no need to argue with him and no need to convince him that you are right. Why? Because he's already lacking insight. You got this from the history. You got this from the history.
So what do we say him?
Okay, he will tell you, doctor, I don't think it's the case with me, but tell me what you're going to do. Don't keep like, for example, no, it's actually the case because you have no, don't do this. What you are going to do is that, let me tell you what we can do right now. What you are going to do. Yeah.
Excuse me for interruption. So we are not getting into the contradiction with him. We are not saying anything.
Never.
Because, but instead of giving him an answer, we just say, let's talk. Let me tell you what you're going to do. Because in our academy, we're given a script. It says that let's agree to disagree.
Let me tell you what we can do for you.
Okay,
this is very enough. Yeah, because let's agree to disagree. That's actually different thing. Why? You can enter yourself. By the way, you mean your academy? Wait, let me stop the recording. I need to ask you one thing. wait, because these things are recorded. Again. Now what are you going to do for me? You are going to refer him to 2 specialists. Doctor, specialist, police specialist. Wait, let me open the video to show you how we're going to act. He will going to say, doctor, specialist, they are working with the police. You will tell him, don't worry, they are specialists, they are doctors like me. The aim here is to help you and support you and to reach the best possible treatment for you. What are they going to do? Now you will tell him that one of the specialists is a the neurologist, who is going to have a talk with you, to take full history from you and examine you. And he is going to do some scans, including CT scan and MRI. And who's the other one, doctor? You will tell him one of my colleagues is going to have a talk with you and chat with you to find out the problems in your life, and they will definitely help and support you better way. After making sure that there is no medical condition or there is no medical reason. So usually we refer to neurologist number 1, and then when the medical reasons are excluded, we refer to psychiatrist. Some few times the examiner may interrupt you and they ask you, Doctor, what's your diagnosis so far? Here comes a problem. If the examiner asks you what's your diagnosis, I'm not really sure, but what I do recommend is that you tell the examiner the patient is having delusions disorder. Because now you are talking to the examiner himself. You are explaining your reason in a good way. Why? It's very safe to mention delusions disorder to the examiner. Because you are going to tell the examiner he is having delusions disorder. Why? Because he is having delusions only delusions, and since 3 months, which means that they are prolonged delusions, and it has affected his life, and there is no symptoms of any other psychiatric illness. So delusions, 3 months, affected his life, no other symptoms of any other psychiatric illness. This means that it is pure delusional disorder. So it's safe here to mention to the examiner that he's having delusional disorder. Doctor, what could be the reason? The reason for any psychiatric illness, is number one, environmental factors like social problems, like financial problems, low socioeconomic, some maybe relationship issues, drug, alcohol. Such problems are the reason for any psychiatric illness. Number two, genetic, it runs in family. Number three, idiopathic, which is the chemical imbalance or neurotransmitter imbalance. You know, the neurotransmitters, when they are imbalanced, usually they lead to psychiatric illness, and this usually happens for no reason. You don't have any explanation for that. Okay, doctor, what are your differentials here if he asks you? Differential diagnosis. Number one, other neurological problems like maybe brain tumor. Number two, electrolyte abnormality like maybe hypokalemia or hypocalcemia. Number three, HIV. Number four, vitamin deficiency, especially the vitamin B12. Okay. Number five, other psychiatric illness like schizophrenia, like depression. Okay. And number six as well, you can say infection. Infection because it's one of the reasons of the confusion. So you are going to say all the differential diagnosis of the confusion. Yeah, you better tell the patient psychosis and to the examiner if he ever asks you, say delusional disorder. But the task here will direct you because if the task do not tell you you are supposed to talk to the examiner after 6 minutes, so do not assume that you should talk to the examiner. You only talk to the examiner if the task tells you. Otherwise, do not. Okay, so now if the examiner asks you what's your further management plan, again, like the mental state. I will take from the patient I will take more detailed history from the patient, medical history. I will do total body examinations or full body examinations, and I will do initial investigations, including blood and urine. After that, I will address his family, or I will try to contact his family if he ever is having, and I will refer him to neurologist to rule out medical conditions and to do further scans. After the neurologist, if medical conditions have been excluded, I can refer him to psychiatrist to take full psychiatric assessment and cognitive assessment as well, and to offer him some treatment. What will be the treatment in this case if the examiner asks you? The treatment here for any psychiatric illness, please, I need you to write the treatment. Number one, family-oriented therapy. How? The patient will likely recover if you talk to his family and explain his condition to them. Okay? So he will more likely recover if you talk to the family and explain his condition to them. Number one. They are more likely to support him if this ever happens. Number two, insight-oriented therapy. What is the meaning of insight-oriented therapy? It is a therapy which works on the patient inside. Okay? Definitely we keep him in the hospital. Definitely we need to keep him here. We need to keep him here. What do you ask me? So number two, insight-oriented therapy, which means that you have to explore the insight or have to address the insight, the lost insight. Okay, by talking therapy. Number three, CBT, cognitive behavior therapy. It's sort of similar to insight-oriented therapy, talking therapy to find out the pattern of behavior which has led him to develop this thought. Number four, social skills training. When this patient is discharged, I need to boost his social skills. I need to teach him how to cope with the society, because some people are likely to criticize his behavior and he will fear them more. Okay? And after that, I can offer him some medications. Which medications I can offer him here? Some like for the associating symptoms, like for the stress and for the liable depression or for the pending depression. I can offer him some antidepressants and some sedatives as well, and antipsychotics definitely. So again, number 1, family therapy. Number 2, insight-oriented therapy. Number 3, cognitive behavior therapy. Number 4, social skills training, and number 5, medications. This is the divisions order. This is the biggest psychiatric problem or biggest psychiatry station. Otherwise, the next stations are quite easy and quite more comfortable. Has anyone got any question regarding this station so far?
Dr. Ahmad, here this patient will react for the admission step that police might be coming. So only we need to say about the reassurance, or any time.
Don't worry. Tell him, don't worry. You are in good hands here. We are just keeping you to have a closer look at your health or at you. No one is coming up to you and say, please here.
No need to say about the admission form or in involuntarily admission form because of his presentation. No need to say those things.
No. Don't say anything.
Okay.
Don't say anything. Just say we need to keep you here. No need to do that. Don't worry about it at all. Seriously, you do not actually, Dr. Yasmin, you are not supposed to discuss each and every single detail with this patient. You just say, yeah.
We can probably say I'm a little bit worried about things you've told me so far, and I think it would be on the better side, and it would be safer if we keep you just for a while to check you over.
Okay, this is a good point, but this is a good point actually, and you can say this. That's absolutely good.
Quietly.
Yeah, nicely and quietly in the same way that you're saying.
Yes.
But the thing is that actually he will tell you, doctor, why you worried about me?
But the things you've been saying. Well, we have checked that he doesn't have an insight into his problem.
Yeah.
So are you aware? Are you always aware that you're feeling this way? Checking inside.
No. Actually,
this is suggestion.
No. I want to tell you something, because how to check the insight? The insight is checked by asking this question: do you think that this is true, or do you think that is real, or do you think you are having this problem? This question is absurd here. This is awkward if you ask him, because he is having this firm belief. He's been having this firm belief that the police is following him, and you know very well that this is not true from the task, because the police have investigated him and they find that he had done nothing wrong. So don't argue with him. Just tell him in the management that we need to keep you here. Yeah, just doctor, why are you going to keep me in the hospital? What have I done? Don't worry, you have done nothing wrong. No one is following you. You're in good hands here. We are just keeping you because we need to make sure that you are absolutely fine. Don't speak about his condition. Don't speak about anything after telling him that we need to admit you. Don't argue with him. For example, don't tell him that I'm a bit worried about you because of the thoughts you have, or I'm a bit worried because of what you told me. Just tell him because we need to have a closer look at you. He will not change his belief. His belief will not be changed. All your mission now is to convince him that you need to stay with us and only reassure. By the way, this guy is not interested in listening to what you are going to do. He's just interested in one thing, that the police is not coming. So the moment you will mention the word police in this station, be prepared to a very tough time. Okay, so next station is suicide. Suicide attempt, the paracetamol overdose. We will discuss the two suicide stations in 10 minutes. I need to finish them quickly. And after the suicide stations, we need also to move to the substance abuse stations, and later on the anorexia nervosa. Okay, so here in this station, simply the suicide. I told you in the introductory session that how to elaborate the suicide. Okay, no problem. Take your time, Dr. Mahdi. How to address the suicide attempt. Here in the paracetamol overdose, you are FY2 working in A&E. The patient has been admitted to the hospital or has come to the hospital after taking paracetamol pills. You are the first, no, the task will not use. Just talk to the patient and address her concern. Address his concern. He was a boy. What you are going to do here in this station, you are A&E. You know what does this mean to be an A&E, Dr. Elvira?
Yeah, there are emergency situations that come by ambulance usually.
Huh? Excuse me?
They usually come by ambulance. There is something emergency going on.
No, not only this. You know why the people fear this station, Dr. Elvira? Because they go and take psychiatric history only.
Okay.
You're an A&E. You're supposed
because
to take.
He overdosed himself, so
yeah, you know the people.
How much he took.
Yes, the people here go and take psychiatric history. People will mostly go and take full psychiatric history from him without asking about the medicine history, which is very important.
Because he took the medicines.
Yeah, exactly. People here will focus more on psychiatric history more than anything else. This is, unfortunately, this is what's going to fail most of the patients this station. This is number one. Number two, when you enter the station, you will find a poor guy, like 16 years old guy, sitting with like a look of shame or look of guilt. You know why he's feeling like this, Dr. Yasmin? Because actually his mother found that he's a gay. So he took the paracetamol tablets and he tried to end his life. So let's see how the station works. You'll enter, you'll greet yourself to him. How can I help you? Doctor, I'm fine. I just want to go home. Well, I'm glad that you're fine. But before sending you home, I need to ask you a few questions to make sure that everything is all right. Okay, what you want to ask, doctor? I could see from your notes that you have been, or you have taken some pills. May I know which pills? So now you will ask. Don't assume that you know that it's paracetamol. Ask him which pills. He'll do some paracetamol. He will barely reply to you. He is very sluggish, this guy. So, which pills? And how much did you? When was that? How much did you take? And how did you take? How did you take? Okay, Dr. No need to do this station because I will just show you one point in this station. I will do that. So how much did you take? And when was that? And how did you take? Like, did you take them all in one go or at separate times? I told you this in the introductory course to write it. And I will write it as well. This is one of the notes that I'm going to provide you beside the domestic violence, the insomnia, the climate change, and the colleague, and the ethics station in general. So how much did you take? And when did you take? And how did you take? Like in one go or at separate times? Any other thing besides them, for example, any alcohol or any recreational drugs? No. By any chance? No, tell me, what have you done after that? What do you mean, doctor? For example, did you throw them up? No, I didn't throw them up. And how are you feeling right now? Do you have any tummy pain? Any nausea? Any vomiting? No. Let's take some. So this is the elaboration of the pills themselves. Number one, which pills? Number two, the amount. Number three, the time. Number four, how did he take them, in one go or at separate times? Anything alongside them And what did he do after that? Did he throw them up? And how is he feeling right now? Any nausea, any vomiting, any tummy pain? Now take some past medical history. Have you been diagnosed with any medical condition? Any liver problem, any kidney problem, any blood disorder? Liver, kidney, blood, because those are the three things that the paracetamol can affect. He will tell you, no, doctor, I'm absolutely fine. Do you take any medications? Any allergy? These two questions are very important here. Any medications and any allergy. Now ask him, now you finish the medical history. You can ask, for example, about smoking and alcohol in the lifestyle. Very enough. Now move to the psychiatric history because number one, you always rule out the medical problems. Number two, when it's safe medically, you have to move to the psychiatric history. Okay, may I know why did you take this course? He may not open up. What if he does not want to open up? You will reassure him. Please feel free to share with me whatever you wish. We are all here to help you and support you. He will tell you, doctor, that he took them because his mother found that he was a gay and he wanted to end his life. I am so sorry for that. This seems to be quite a tough time. May I know when were you when you took them? He will tell you, doctor, I took them in the bathroom, for example. And was there anyone else with you? Why I ask these questions? Because I need to see if he was at risk or he was forced to suicide or not. Was he, from where did he get this pills? And to see the risk assessment. Okay, so he did this at home and no one else was with him. And what did you do after that? He will tell you, doctor, I called the ambulance, I called my boyfriend and he asked me to take the ambulance and come here. I took the ambulance and I came here right away. Can you hear me right now? What was missing, Dr. Bina? Open the mic and tell me, since when have you missed? Hello? Hello? Hello, guys, can you hear me?
Perfectly, yeah.
So, Dr. Bina, what's wrong? Over psychiatric history. So, again, you're going to ask him or her, you're going to ask him, may I know why did you take them? He will tell you the reason. And when, where were you? And was there anyone by your side then, or was there anyone with you? And what did you do after that? He called his boyfriend and he asked him to take the ambulance and come here. Okay? Okay. No, don't ask why in the beginning. Because this why is psychiatry. Why you usually postpone it after checking the medical problem itself. So now you elaborated the incident, number one, took some medical history, number two, and number three as well, you have to ask the psychiatric history, like the psychiatric elaboration of the incident itself. Now, what you're going to do, again, the famish, again, family and relationship with them, friends and relationship with them, including the boyfriend, and finances, and how is he coping with the school? Does he have any problem with the law? The famish, the 4F. After the 4F, you will ask about the mood. This guy has just come off suicide. Sorry, I forgot two important questions to be asked in this station. Can anyone tell me what I forgot here? No, not mood. I just said the mood. Yeah,
Did you
exactly.
took it along with alcohol?
No, I told the alcohol. This means that you are sleeping, Dr. Maria. I said about
Did you-
alcohol and nutrition drugs. Yes,
Did
the
you
plan
plan-
and the grades.
And
Yeah,
a note, yeah. Did you leave
Yeah.
a note?
yeah.
Or it was by impulse?
This is very important. Thank you for pointing this out. So before the famish or the 4F, I need also to ask about the RRP questions. So I asked about the medical history. After this, some psychiatry, like why and who was with you and where were you. After that, I need to ask the RRP question. What are the RRP questions? How do you feel about what you did? He will tell you, doctor, I'm feeling so bad. See, he already feels guilty. So, have you ever thought of harming yourself before, apart from this time? Which is the recurrence, the second R? No, doctor, I have not. Do you think you are going to do it again? No, doctor, I don't think so. I already feel bad. Have you ever planned harming yourself this time? He will tell you no. Have you left a note? No. So again, how do you feel? Have you ever planned to harm yourself? Have you left a note? And do you feel you are going to do it again? The RRP questions, very important. We elaborated them in details in the first session. Okay, so now you can ask about the FAMISH, the 4Fs. P question, the planning. Have you ever planned to harm yourself? Or have you left a note, suicide note? Okay, now move to the, we said the 4F, and now ask about the mood. Very important to ask about. You can also ask about alcohol and recreational drugs after the mood. You know the FAMISH. After the mood, you can ask about alcohol and recreational drugs. And after that, you can take some, like for example, do you have any mental health problem? Any family member with any mental health problem? They will tell you no, doctor. Absolutely fine. So now what you are going to do to this patient, you are going to do some examinations, including tummy examination. And you're going to do some further investigation. Which investigations you are going to do in this case? The examiner may ask you or may not ask you. By the way, this guy has taken the paracetamol tablets 2 hours ago. What does this mean? That he took it 2 hours ago only. Can anyone tell me? If anyone can elaborate this, I'll be thankful.
Usually, it's the timing of taking the tablets crucially important.
Very important. You know why?
Yeah, the level of the paracetamol in the blood
Perfect.
should be checked.
Perfect. That's what I wanted to hear. This is very important, guys. Because, yes, Dr. Manisha. No need, Dr. Yemi. You are going to tell him that in the management, we need to keep you in the hospital. Why we need to keep him in the hospital? Because we may need to assess your paracetamol level in 2 hours from now. We are going to take a sample and assess it in 2 hours from now. Depending on the level of the paracetamol, we may start you on a medication we call N-acetylcysteine, or just say a medication as drip in your blood vessel for this, which is called N-acetylcysteine. So, doctor, I don't want to stay in hospital. You know why? Doctor, I don't want to, I'm fine. I'm glad that you are fine, but as I told you, this medication can be started, and I'm afraid actually we need also to do some other tests. So you are going to monitor the paracetamol level and give N-acetylcysteine, and you are also going to take some liver and kidney and the blood tests, kidney and liver function test, and the clotting screen. Very important to take from him. Okay, doctor, so how long will it take this treatment? You will tell him 21 hours. 21 hours is a course of N-acetylcysteine. And what will happen after that? Can I go home after that? Actually, after finishing the course of the treatment, we need to monitor your paracetamol level again and the liver and kidney functions again. Doctor, what will after that? Can I go home? I can really imagine how it can be frustrating. But we need also to send you to one of our colleagues to have a talk with you. Which colleague? Psychiatrist. Doctor, do you think I'm crazy? I'm so sorry if I give you this impression. But it's just, he's going to have a talk with you to find out the stress you're having in your life, to sort it out for you. Okay, doctor. Now you will offer him some support. For example, you will tell him, would you like anyone to be by your side? He will tell you, doctor, my boyfriend is here waiting for me. Okay, that's fine. So again, the management plan, number 1, keep in the hospital. Number 2, check the paracetamol level and kidney and liver function test and the blood. Number 3, start N-acetylcysteine if the paracetamol is high after 4 hours. Number 5, the N-acetylcysteine takes up to 21 hours course. Meanwhile, you'll be monitoring the paracetamol and liver and kidney function tests during and after finishing the NSL sustain. Number 5, you will refer him to psychiatrist to talk to him like CBT or talk to him to find out what happened. And you will offer support in the end. Was this clear? This station is very short. Please do not lose this station. Do not lose this station. Please. People usually stumble in this station. Support Dr. Yasmin like you are going to ask him, for example, do you want anyone to be by your side at this time? Because he is likely to be admitted and he is already coming out of suicide attempt, so he needs some support, like someone to be by his side. So you will ask him about this and he will tell you, doctor, my boyfriend is waiting for me here. Okay. Family or friend support. Exactly, Dr. Yasmin. This is the support you are looking for. Give me 1 minute, guys. I'm sorry. The task here say that the patient is medically stable. She has just taken some pills, oral contraceptive pills, and she has cut her wrist. She has cut her wrist. So she did 2 things. Now you will elaborate. She is medically stable. You will enter the cubicle and you will find that she is having poor eye contact again, like the previous one. And she will tell you that she is fine. She wants to go to hospital. You will reassure her the same way, and you will take history. But here you will only take psychiatric history. And what is a psychiatric history? She will tell you, doctor, I took some pills. May I know which pills? And why did you take them? No, here you can move directly to the why, the reason. Because this is a psychiatry station. I mean, you're in psychiatry department. Why did you take them? She will tell you that she took them because she missed the period, because she had unprotected sex. She missed the period and she thought that she is pregnant, so she decided to abort herself. You can ask her, may I know when was the last time you had unprotected sex? Or if you are in a relationship, when was the last time you had unprotected sex? Like this. You can ask like 2 or 3 questions from psychiatric history, from the sexual history here, meanwhile. And after that, again, ask her, may I know where were you? Was there anyone by your side? Were you under the effect of alcohol or recreational drugs? Were you under the effect? In the previous station, I asked it that if he took alcohol or any other drug alongside, because this was medical history. But here you have to ask, were you under the effect of alcohol or any recreational drugs? It is same, but a little bit different. Why? Because here you are in psychiatry. You are supposed to ask, were you under the effect or under the influence of alcohol or any other drugs? Okay. After that, what did you do after that? She will tell you, doctor, I don't know, I just went to bed. Okay, now you can ask her, and regarding the cut wrist, now you can elaborate the cut wrist. Tell me about it. What you want to know, doctor? Why did you do it? She will tell you, doctor, because I woke up in the morning and I found no blood. That's why I decided to end my life. Sympathy and empathy throughout this station, please. Now ask her, is it superficial or deep? The wrist, the cut wrist. She will tell you, doctor, it was superficial actually. And where were you when you did this? Was there anyone with you again? Again, same questions. And what did you do after it? She will tell you, doctor, she called her boyfriend, and her boyfriend asked her, she told her that she's crazy, and he hanged up against her. So that's why she came here to the hospital. She came to the hospital now after cutting the wrist, and she has been medically stable and medically treated. Okay, okay. So you elaborated the 2 instances, the OCP and the cut wrist. Usually the people think that it is overdose of OCP plus cut wrist. No, she took OCPs, normal number of pills, to abort herself. Many pills actually, but not overdose. Many pills to abort herself. When she did not manage, now she cut her wrist. You will elaborate both things in the same way. Why and when were you? When was that? Where were you? Was there anyone with you while doing this? And what did you do after that? Okay, now we will ask about the RRP question, the recurrent, the regretfulness, and the planning again. After this, you will ask the famish again. But in the famish, you have to ask about the boyfriend in the prince pattern. Why the boyfriend? Because you have to assess if it is abusive relationship or not. The old or the age of the boyfriend, the relationship together, how the relationship, those things like how old is he, how is your relationship together, has this affected your study, the relationship. Okay, then ask about the finances and the forensic as well, the 4 Fs as I said. And now you ask about the mood. Very important to ask about the mood here to see if she was already depressed or not. Again, after the mood, you will ask about alcohol or recreational drugs. After this, any mental health problem. Okay, now you do not need to examine the patient because you are in psychiatric history, nor you will do any investigations. But what you are going to do, you will ask her that. Yeah.
Oh, sorry.
No problem.
Do we do here psychiatry screening? Like,
yeah, you have to.
Broadcasting and.
No. Listen, this is called acute psychiatry, Dr. Elvira. In the acute psychiatry, you take only the risk assessment and the relevant things, but do not ask why. This patient is not having any psychiatric illness. She just has suicide attempt. Suicide attempt history, you do not assess the cognitive function, you do not assess these things. She is absolutely fine. She's already feeling bad and regret what happens. So no need to assess the truth and the hallucinations and such things, because these things actually are irrelevant here. You can ask them in any detailed psychiatric history, but here this is acute psychiatry, in which you should only ask about the event itself and the risk assessment. The acute psychiatry is different from these things. This is a single event. This is not prolonged problem. Okay, now we will tell her that we need to keep her in the hospital. Doctor, I'm fine. Well, actually, the aim here is that we need to have a talk with you. So you will keep her in the hostel. You will involve the senior to come and talk to her. For that, we need your mom to be by your side. Why we need her to bring her mom? Because she needs support. Anyone who's coming out of suicide needs support. Actually, this is one thing. One other thing as well is that if she will let her go home, she will likely fight with her mother and she may start suiciding again. So you need to keep her in the hostel. We need to talk to you, me and my senior. I will ask my senior to come to talk to you. And it's a better idea to ask your mother to come to support you and be by your side. She will tell you, doctor, but why call my mother? I don't want her to know. I'm sure it must be frustrating. But the thing is that you need her support at this time more than any time before. And we also are going to talk to her and explain the situation to her and discuss some few things with her. She's 14 years old, by the way, or 15 years old, I think. So she needs some support by her side. This is number one. And number two, you need also to involve her mother about the treatment plan sometimes. And this is one thing as well, is that if she goes back home, she will fight with the mother and she can't suicide again. So keep her in the hospital and encourage her to ask the mother to come. You and your senior will talk to her and to the mother and decide the best possible treatment with her. This is number one. Number two, you have to refer her to OBG department. Ask her, have you done any pregnancy tests? She either tell you yes or no. If she did not do any pregnancy tests, you will refer her to the OBG to do some pregnancy tests, okay, for her. What will she do to me, doctor? If the pregnancy test comes positive, they may discuss with you the further management plan about this, or the best possible decision for this problem. So you will refer to the OBG department to do pregnancy tests, and if it comes positive, they will discuss the management or the plans with her. Okay? And then in the end, you can ask her about if she needs any further help or support. Like any question or any station, you have to ask about any further help or support in any psychiatry station as well. Was this clear? This station is quite similar to the other one, but the fact that it's longer, a little bit longer. But the good thing is that you are in psychiatry department. You do not need to worry about anything. I hope this was clear. Has anyone got any question?
So, sir, how much did I miss up till now?
You missed the two stations, the delusions and the paracetamol overdose. Paracetamol is definitely similar to the this one, the OCP and Kgdwt. The paracetamol overdose is quite similar, but the delusions order, the recording will be posted to you. Don't worry about that.
Okay.
Actually, I will
Okay.
record the delusions order in separate because many people have asked me to record only this station for them. So I will record it and send it to you separately.
Okay,
But just to concentrate on, I mean, it will be 10 minutes recording only. So I will
yeah,
explain to you everything about how to tackle it in the station. Okay,
okay.
let's move to the next one, which is substance abuse. Substance abuse are quite good stations. I consider them quite good. Why? Because they are quite straightforward. Only the alcohol lady does not think that she's having alcohol problem, but you can convince her. So here the task says that for the alcohol, your FY2 working in psychiatry department, the patient has been admitted. So your FY2 working in psychiatry. Sometimes the task will tell you your FY2 working in surgery, whatever. But here actually, I believe that you are FY2 working in psychiatry because you are going to talk to her about the alcohol habit. So how come you can be FY2 in surgery and you are going to take psychiatry history? No. So you are FY2 in psychiatry department. The patient has been admitted to the ward a few days ago because she has come out of hysteroscopy. Hysteroscopy. Hysteroscopy for the uterus. Okay? So she had been admitted after the hysteroscopy. Your nurse colleagues have noticed that she has been drinking too much, and they were concerned about her alcohol habit. Talk to the patient and discuss the alcohol habit with her and address her concern. Now you will enter to the patient. You will talk to her. You will tell you will ask her again. She was admitted in the hospital, so it's better to ask her. May I know why were you admitted to the hospital? She will tell you that she was admitted for hysteroscopy, camera test, and she has received the results, and the results came back normal. I'm just glad. She's glad. She wants to go home. That's good. Now encourage her and reassure her that it's very good that you are feeling fine. It's my pleasure, really. But I just need to ask you a few questions. Now, how are you feeling right now? Now assess her current condition. Like, how are you feeling? Do you have any pain? Like this. Move to the psychiatry. Actually, do you have any idea why I wanted to talk to you? She will tell you, no, doctor. Now you can ask her, actually, there have been some concerns about maybe, don't you think, you can bring it this way. There have been some concerns regarding maybe your drinking. Don't you think you drink a little bit on the higher side in the past days? So you can bring it this way. Like, for example, actually, I'm a bit concerned about your drinking. Or you can bring it this way. Do you drink alcohol? Or you can bring it this way. Let's speak about your lifestyle. Do you smoke? Are you physically active? May I know if you drink alcohol? She will tell you, yes, doctor. Actually, that's why I'm concerned a little bit and I wanted to talk to you. So you can bring it in either way. You can bring it, but don't be too bold. Don't say I'm here to talk to you about your alcohol habit. No, actually, I'm a bit concerned because I have been told that you have been drinking on the higher side. Or you can bring it by asking some lifestyle questions and let the alcohol be in the end. This way, I prefer it. Now she will tell you, doctor, it's not a big deal. I will just taking some few sips. every other day. Let's speak about your alcohol if you don't mind. She will tell you what you want to ask. She can be reluctant. If she is reluctant at any point, please don't worry, I'm just here to ask you a few questions. I'm not here to judge you nor to catch you out. Okay, so now for the alcohol, you will ask her, since when have you been drinking? How much do you drink? How often? She will tell you at how often. She will tell you, doctor, I don't drink much. When she says this, you have to ask her to be specific. Like what, doctor? Like, for example, how often or how much did you drink in the past weekend? She will tell you, doctor, I have drunk 2 glasses of wine. So she drank too much, actually. So you better be precise and ask her, may I know, for example, or can you be a bit more precise about how much did you drink? Like, for example, in the past weekend. She will tell you, yes, doctor, sure. I drank in the past weekend like maybe 2 bottles of wine. Now, you will tell her, for example, now you ask her about how much and how often and since when. Now, ask her, for example, have you ever, do you take anything else besides alcohol? Or you better signpost. For example, you tell her when when the people drink much alcohol, they tend sometimes, or when people drink alcohol, sometimes they tend to take some other things. So by any chance, have you taken any other drugs? She will tell you, no, doctor, no, never. Okay. You better signpost about recreational drugs by saying that when people take the thing, they sometimes you also take the other thing. So by any chance have you taken it? No. Okay. Now move to the Kgdwt questions. The core of this station is Kgdwt. Kg stands for C, cutting down. Have you ever thought of cutting down? She will tell you, yes, doctor. When was that? 9 months ago, doctor, I went to Alcohol Anonymous, but I couldn't manage. May I know why? Doctor, I just experienced some hand shaking and tremors and tummy pain. That's why I couldn't stop. But the good thing is that you tried once before, which means that you can do it one more time. Okay, the A stands for annoyed. Do you feel annoyed when someone speaks to you about your alcohol habit? She will tell you, doctor, you know what? People like you make me feel annoyed. So now we will tell her, I'm really sorry if I give you this impression. I didn't mean to annoy you. I'm just asking you for your health. Okay, the G stands for guilty. Do you feel guilty by your drinking? She will tell you, yes, doctor. Sometimes I feel guilty because I can't take care of my family or my husband properly when I drink too much. E stands for eye opener. Do you drink alcohol as a first thing in the morning? First thing in the morning. First thing in the morning. Always ask this question. DWT questions. The D stands for dependency. Are you able to perform your daily tasks without alcohol? W stands for withdrawal symptoms. Have you ever developed any symptoms if you did not drink alcohol? By the way, she told you already that she had experienced withdrawal symptoms before, so it's better not to repeat it now, if she already told you. T is tolerance. Do you think you need to increase the amount to reach similar effect? Okay. You asked about the Kgdwt, now ask about the mood, and ask about suicide. And then ask about famish. No problem, Dr. Muniba. Ask about famish, like 4F, family, friends, finance. And by the way, you'll find that in the family, her husband criticizes her alcohol habit. And in the friends, you'll find that she usually meets with her friends and they spend their time drinking together. And in the finances, in the job, she works in a bar. So definitely there is higher risk of recurrence, higher risk of abuse. She is at high risk because she has many factors to lead her to this abuse. Okay. Then ask her about have you had any problem with the law because of this problem? She will tell you no, doctor. Ask about, you can here ask about insight as well. For example, no, you don't need to ask about insight. You need to ask some like cognitive questions, like about hallucinations. Like, for example, you can ask her, have you seen some things that the people cannot hear? Why? Because alcohol can be associated with hallucinations sometimes. So you can ask her, do you see some things that the people can see? Or do you hear some things that the people can't hear? Sometimes you can ask hallucinations in this station, after asking about the mood. Okay, now do you have any mental health problem? Any mental health problem runs in your family? Any medical problem runs in your family, like what we said before. Now move to the management. In the management section, you will tell her, from my assessment or from our talk, didn't you think that you are having an alcohol problem? Sometimes she can tell you, yes, doctor. Sometimes she can tell you, no, doctor, I don't think so. But tell me what you can do to me, doctor. So sometimes she doesn't think that she's having alcohol problem, which means that she is lacking insights in terms of this problem, the relevant insight, the insight to this problem. So she will ask you, doctor, what are you going to do to me then? You will tell her that we can refer you to alcohol support, or to one. Sorry, we can refer you if you are FY2 in psychiatry. So at this point, you can ask her, or you can tell her, we can provide you with some options, and some options, like some of them are medical and some are non-medical. Usually for the alcohol cessation, you are a psychiatrist, so you can provide here some non-medical and some medical options. What are the non-medical options? Alcohol Anonymous. What are the medical options? Are the drugs, like the dicyclopram and acamprosate. Okay, okay. So again, what are the non-medical options? Non-medical options are Alcohol Anonymous. What is Alcohol Anonymous? You have tried it before, so no need to explain it further. But you can tell her that it is it's a sort of group, Alcohol Anonymous, which will help you quit alcohol. They can provide you with many options. One of them is trained advisor, who can talk to you about your alcohol habit. Also, you can attend some group therapy or groups, the people who used to drink alcohol and they quit, so you can learn from their and benefit from their experience. You can also gain an access to the online website about alcohol quitting all the time and benefits of it, and some helpline for any further support. This is Alcohol Anonymous. Number 2, the medical options are dicyclopram and acamprosate and diazepam. Acamprosate, it blocks the pathway in the brain which pushes you toward alcohol, and it reduces the withdrawal symptom. So acamprosate reduces the withdrawal symptom. Dicyclopram produces unpleasant effect when you drink alcohol, so the chance of quitting is higher with it. Number 3 is diazepam. It acts on the stress and the alcohol withdrawal symptoms. Okay, so again, acamprosate, dicyclopram, and diazepam. Diazepam is for the stress and the withdrawal, and acamprosate is to reduce the withdrawal symptoms, and the dicyclopram is to produce unpleasant effects in case she drinks alcohol again. She will tell you, I can consider this, doctor. Thank you. Thank you. So this is the alcohol abuse. Very easy station, but the girl or the lady is stubborn, but you can convince her. If at some point she can tell you, you can ask her in the beginning of the management, don't you think you are having alcohol problem? She will tell you, she will smile at you and tell you, no, I don't think so. You will ask her, may I know why? Because doctor, I have been drinking like this and I'm fine with that. So you can now tell her about the complications of alcohol. Or you can simply tell her about the benefits of stopping alcohol and the complications of drinking alcohol. What are the benefits? Benefits of stopping alcohol and the complications at the same time is that stopping alcohol can boost her health, because the alcohol can have some long-term effects on the heart and in the liver and on the brain itself as well. And it can harm her finances, harm her balance and coordination, and can cause some further troubles with her husband as well, and affect her caring. Okay, the core in this station is number one, reassure her and try to be convincing. Number two, please do not judge her. Do not judge her when you are entering the station or when you are managing her. Please. Okay? Okay. Let's move to one other station which is quite similar to it. The heroin addiction. In the heroin addiction station, actually, I consider this is one of the easiest station in PLAB 2. The guy is quite aware about his condition. The guy knows everything actually, and he's here to quit alcohol, to quit heroin. The guy actually is here as well because he's having some problems regarding his addiction, and he wants to get rid of them as soon as possible. So what we can do here is simply you have to be reassuring, too much reassuring in this station. How can we be reassuring in this station? You have to tell him that you did the right thing by coming to here. This guy has chosen or have taken the decision that he needs to come to quit. This guy is quite aware and quite conscious. So keep reassuring him and telling him that you did the right thing by coming here, and definitely we are going to help you and support you today. We will sort it out in a while. For that, I need to ask you a few questions. Which questions? Okay, now you will ask him regarding the substance abuse habit. You will ask him, when did you start taking it? And how did you start? He will tell you, doctor, I started for recreational use, but right now it became an addiction. Okay, and how much do you take? How often do you take? Here, very important thing you need to add from the alcohol is that you also have to ask him, you need to ask him, how do you take it? Why? Because the heroin can be taken IV. So how do you take it? He will tell you, doctor, I injected. So by any chance, do you share any needles? So here, the only addition is how do you take it and do you share needles or not? He will tell you, doctor, I'm on a needle exchange program, which means that he exchanged the needles, the disposed needles for clean ones or for sterile ones. Okay? Okay. Now you will ask him, by any chance, any other drugs? He can tell you sometimes that he was taking amphetamine as well, but he stopped it. Okay. So now you will ask again the Kgdwt question. The same like alcohol exactly. But please mind here is that you cannot ask about the E, which is the eye opener in the heroin, because no one on earth takes heroin as an eye opener. No one takes heroin as an eye opener. This is never available in any country in the world. Heroin as an eye opener, no one ever does this. So usually they take heroin like in a night, like nighttime in a gathering, like this. Okay. Okay. So now you asked about the Kgdwt questions, if I'm not mistaken. After the Kgdwt questions, you will ask about the famish. The famish here, very important, very important. The famish here is the most important thing in the station, because you'll find that his relationship with his wife is tense because of the heroin. She also is heroin addict. What a family. And number two, you'll find that this sometimes has caused him some financial problems. So this is from the finance. He had to quit his job because he's not concentrating and he's on benefits right now. So this guy has finished all his benefits on his heroin. So he's having seriously financial trouble because of this. Number three, you'll ask about the friends. You know, when someone is having spoiled friends, they tend to be more spoiled. So he will tell you that he spends his time with friends taking heroin. This is another risk factor. So his wife is addict. Friends are addicts. and he is on benefits. He has consumed or expired all his financial support. Let's add one more thing. When you ask him about the wife, do you have any children? He will tell you, yes, doctor, we have a little daughter. Couldn't this affect the parenting of the child? Yes, definitely it can. So you can ask him, has this affected the parenting or the care for your child? He will tell you, no, doctor, no, we don't. We keep this away from her. We never. This never influenced her, the little daughter. Okay. Number 4, the forensic. Have you had any problem with the law? This guy has tried to steal a shop before. So yes, doctor, I tried to steal. Definitely, he tried to steal to find money to buy heroin. Okay, now you can ask about some hallucinations. Do you see other things around that the people don't see, or which people don't see? Do you hear something that the people do not hear? And you can also ask about the mood as well and the suicide and some mental health problem in him or in the family, like the remaining psychiatric station. After that, you will tell him it's very thoughtful of you to come today to seek help. So actually, I'm glad that you wanted to quit heroin. For that, we can help you and support you by various ways. Some non-medical and medical options, exactly like the alcohol again. Medical and non-medical. What would you like me to start with? He will tell you, doctor, start with the medical, please. With the medical, you are going to give him methadone. I'm going to discuss with my senior and we can prescribe you some medication we call methadone, which will prevent the withdrawal symptoms from heroin and enables you to stop. What is this drug, doctor? It is like an opioid as well, but its effect is shorter. So it wears off. I mean, usually it is a sort of like with opioid, which will help him like quit the methadone, quit the heroin. Doctor, are you going to give it to me now? You will tell him that I need to discuss with my senior and we will run further investigations for you before prescribing. Which investigations, guys? Usually the methadone affects the liver and the kidney and the thyroid gland and the heart. So you need to run further body investigations before prescribing or putting him on methadone. And if everything comes fine, we definitely will prescribe it to you. And you can also offer him HIV screening because he used to take needles or take heroin IV. So HIV screening always offer him. Also, we need to test you for HIV. Would you like to have this? Yes, doctor. HIV screening always comes after the patient consent. So you always take his consent for HIV screening. So now you put him on methadone. Few instructions for the methadone. What are the instructions? Instructions for methadone are number 1. You need to take, we will start you with a small dose, low dose. And you'll be taking it under supervision of pharmacist, at least for the first 1 month. Why pharmacist? Because he needs to supervise his compliance and if he developed any of the side effects or not. After that, you can gradually increase the dose and we will be monitoring him all the time. When everything is fine and he's stable, you can simply taper the dose gradually, like lower the dose. So low dose, they increase it gradually under effect or under supervision of pharmacist. Now taper the dose or lower the dose gradually as well after some time. Why I lower the dose gradually? Because this is called detoxification. And instead of stopping the methadone suddenly, because the methadone itself is opioid, so you do not, but it is weaker opioid. So you do not need to stop it suddenly, otherwise it will cause withdrawal symptoms. So now what you can do after reaching the dose of the methadone, you will taper it slowly till he experiences no withdrawal symptoms at all and you will stop it. This is called detoxification. One more thing, you will be providing him with a carer. This carer will supervise his abstinence from heroin. This carer will supervise him at least for the next 3 to 4 months. Why the carer? He will supervise his compliance with the methadone as well, and he will check if he's still taking or like missing heroin or not. And he can also provide him, or he can also talk to the local council and try to provide him with another job. So this care is mainly for the prolonged addiction, especially when it comes to heroin. This care will supervise his abstinence, and this care as well will arrange the plan or the future job plan for him. What are the non-medical options, doctor? The non-medical options are narcotic anonymous, like alcohol anonymous. Same way, narcotic anonymous. Again, some group therapy, some advisors, online access, and helpline. But more important thing is that here you have to add that his wife is also needs to come. You'll ask him, did your wife thought of cutting down? He will tell you, doctor, I don't know, I have to talk to her. Now, very important to advise him to bring the wife. Why? Because she needs to abstain as well. Otherwise, this will affect the caring or the parenting of your child. And in this case, if your child is compromised or her safety is compromised, you need to involve social services. Again, you need to bring the wife. You encourage him to bring the wife because being two addicts, this can influence their parenting to the child. So we need to test her and we need to start treating her as soon as possible as well. Last thing, you can also tell him that, and you can tell him also as well that you are more likely to abstain from heroin if your family supports you. So if your wife is taking heroin, it will be more unlikely to you to stop heroin. What are side effects of methadone if he ever asks you? Drowsiness, some like sexual problems, some problem with the liver, some problem with the kidney, some heart problems. For the drowsiness, you are going to advise him to not operate heavy machinery and to not drink alcohol and to not sign important documentation at least for the first few weeks till he gets used to it. Okay, and those effects are usually temporary. But still, you advise him as safety netting because anyone who is going to have drowsiness, we advised about this before. So the only difference is that here you will arrange a carer to him. Why the carer is very important to follow him up and provide him with support. Okay, guys. This is a station of substance abuse which I truly like. Quite straightforward and quite easy. And very nice chat, and the guy is here with his own will to stop. Okay. And you need to ask, yes, sure. You ask about allergies. This is a good point, Dr. Yemi. After finishing the mental health problem, I told you that you need to ask a few questions. Do you have any medical condition? You guys, the M in the famish contains the mood and the medical and mental. In the mental, you need to ask, for example, do you have any mental health problem? Any family history of any mental health problem? Do you have any medical condition? Do you take any medications? Do you have any allergy? Like 2 or 3 questions from each one. And by the way, before prescribing the methadone, one more thing, you need to discuss with the senior. I told you that you need to discuss with the senior as well because this is a long-term treatment and you are in psychiatry. So you are supposed to do it under supervision of someone. Okay. Has anyone got any further question? Okay, wait 1 minute, guys. Actually, we are just left with the anorexia nervosa and depression. Depression is quite easy station. Anorexia nervosa is only left. So you can take 10 minutes break. After this break, we will discuss the counseling sessions or the counseling stations. He told you, Dr. Masih, he told you that this has affected his life in terms of his family and his finance and his thing. And good point, you can ask him in the beginning as well. But you know, in these stations, in psychiatry stations, you can skip this point actually. Why? Because you are going to take full psychiatry history to know how has it affected his life. But this is a good point actually. You can ask him. You can ask him as well still. But I mean, I do not say that it's wrong to ask. But still, you are going to ask him in details in a while, like family, friends, finance, mood, and everything. Okay. So yeah, I will be back in 10 minutes hopefully. I'm giving you a break right now. We are going to resume the anorexia nervosa, and after that, we're going to do the counseling sessions, which are all quite similar today. But I need you, please, in these few minutes, I need you to listen to the recording which was posted yesterday to our group, the recording of the counseling stations approach. Okay? In the counseling stations, I need you all to listen to it because we'll be following it in these stations. They are quite easy and no need to waste too much time in them. Hello, everyone. I'm sorry for the delay. We are back right now. Are you here? Did you sleep? I will send on WhatsApp right now. That we are back. Okay. Everyone is attending back again, or still people are in break? Okay, guys. So
Ahmed, can I have a question?
yeah, sure.
Before how we are supposed to say everything in what you mentioned regarding this one, heroin addict, and the way of management, and
Usually,
according to your
yeah.
what you have summoned.
I will tell you one thing. You speak about the methadone in less than 1 minute. You are going to tell him we are going to prescribe your medication, which will prevent any withdrawal symptoms that you'll be having when quitting heroin. Before that, I will discuss with my senior because we need to have further investigations for you. Which investigations, doctor? You will say some heart investigations like ECG and thyroid and kidney and liver function. Doctor, how should I take it? You will say that you'll take it, we'll start with the low dose and you'll gradually increase it and you'll be taken under supervision of pharmacist. This is 1 minute. I mean, when he asks you why the pharmacist, this will take you 1 minute. In the non-medical management, you will speak about it in 20 seconds. Narcotics Anonymous, they are going to help you and support you. You can meet with other people or with other groups who have quit heroin before, and this will definitely like push you to or like excite you more, or like how can I say, like encourage you more to abstain from heroin. And also you'll be provided with some helplines or some access to internet. Also, one more thing, social, sorry, you'll tell him that your wife has been taking heroin, so it's advisable to bring her here. So this management should not take you more than 2 minutes, believe me. It will be very short, you just try it. But do not spend too much in the history. Why? Your history here will barely take 5 minutes, by the way. The guy is quite straightforward. The guy acknowledges everything.
Okay.
When you try practicing it, Dr. Zaid, I have a good idea. You will just speak about, you will start with the medical management. Why the medical? Because the medical is the core, the methadone. And you will speak about the management of the methadone in 1 minute. Don't speak, like, just say that you're going to start with low dose after doing some investigations. You need to start with small dose or low dose, and you will be increasing it gradually, for which we are going to send you to take it under supervision of pharmacists. See, this is the management, or this is the methadone.
Yeah. Right. I understand. Yes.
Okay. Anyone wants to ask about anything in the previous station? Anyone needs to ask any question so far? Okay, let's move to one easy station, the depression, and after it, the Anorexia Nervosa. Mind that in the next stations, starting from the counseling stations, will be quite fast. Why the counseling? Because the counseling contains nothing new. Please, we will be fast, okay? Okay, so the thing is that here in the depression station, it came first in February, in the 1st of February actually, and the patient is having weight loss. This is a presentation. So in the weight loss, what are your differentials in one who's like 30 years old and she's having weight loss? What are your differential diagnoses, Dr. Nigar? Dr. Nigar, tell me, what are your differential diagnoses for someone who is 30 years old and losing weight? Dr. Nigar, tell me. Open your mic and tell me. Tell me right now. Dr. Nigar, Are you listening?
Yeah. Hello. So
Yeah.
what was the question? Can you tell me again?
If someone is 30 years old, 30, and she is
Yeah.
losing weight, what are your differentials?
Is anorexia nervosa or hypothyroidism or cancer patient
Hyperthyroidism and cancer, and what else?
and depression as well?
Why do you think depression? Why don't you rule out the IBD, celiac disease?
Yeah, celiac disease, IBD, yeah, that thing as well. I forgot.
Okay. So the core is that you never assume any psychiatric problem unless you ruled out what the medical problem.
Okay.
Okay. Okay. So this is what I recommend, is that in this station, because it came new in one day, what happens? What happens is that simply you will enter the station and you will take some history from here. You will elaborate the weight loss. What are the associating symptoms to the weight loss usually? The associating symptoms could be maybe some heat intolerance, sometimes could be fever, sometimes could be shortness of breath and tiredness, like anemia symptoms, lumps or bumps. So the differentials here are cancer, number 2, hyperthyroidism, number 3, any alteration in the bowel habits for the IBD. She will usually, this girl or this woman doesn't have any other symptom. So when you find nothing, which question to ask when you find nothing conclusive? I need one question. One question can point you toward everything. Yeah, exactly, Dr. Manisha. The idea. The idea is very important here to ask. She'll tell you, doctor, I don't know. I'm here to you because I need to find the reason. So she doesn't give you anything. So now you can ask her about the lifestyle and you'll find nothing conclusive. But in the diet, she will tell you, doctor, you'll ask her about her diet. Or sometimes if you forget or if you ask her in the medical history, for example, when you are ruling out cancer, you will ask her, do you enjoy your appetite as before? Because you know loss of appetite is one of the symptoms of cancer. Usually she is young age, but you still need to ask these questions. Do you enjoy your appetite as before? She will tell you no, doctor. If you forgot to ask it in the medical history, you can ask it in the lifestyle. She will tell you no, doctor. Can you, any particular reason for that? She will tell you, doctor, I'm feeling a bit low. So now you know that the reason of her weight loss is due to the loss of appetite, which is due to depression. She is feeling low. Now ask about the mood, score the mood. Ask about suicide. Before suicide, you have to signpost. When someone is feeling low, they tend to harm themselves. So by any chance, have you ever thought of harming yourself? Ask about the famish, as we said always. And now we will get to know that you are in GP, by the way. So you are going to examine her. Which examinations? All the examinations, including tummy examination, neurological examination, and everything. We need to do some investigations. The examiner may keep quiet. Which investigations here you need to do? Routine bloods and urine. Routine bloods and urine. Very enough. Okay, doctor, what's wrong with me? Well, from what you told me, seems that your weight loss is not due to any medical problem. However, we need to run further investigations to confirm the cause or to find the cause. Having said that, if all the investigations came back normal, most probably you are having a condition we call depression. So you need to tell her that her weight loss is not due to a medical problem. So I'm suspecting that the cause here is a condition we call depression. After the investigations come back normal, we need to confirm that. What is depression? Is it a low mood, doctor? You will tell her that depression is not only low mood. Actually, it can be associated with some physical symptoms, like maybe tiredness, sometimes weight loss due to loss of appetite, some other times lack of energy, lack of desire in the life, lack in everything. Doctor, why did I have it? Simply she knows that she have it because actually you will tell her one of the questions you need to ask her when she tells you, doctor, I'm feeling low. You will tell her, may I know why? She will tell you that she had breakup few months back. So you will tell her that it's usually because of your breakup. which you had recently. What are you going to do for me right now? We need to run medical investigations or further investigations to you to find out the cause. And when the investigations come back normal, we definitely can provide you with a variety of options for your depression. Again, for any psychiatric, non-medical, and medical. The medical, you are going to refer here to a psychiatrist, or you can even, by the way, the depression can be treated in GP. So we can provide you some options. The non-medical options are in the form of talking therapy, in which you are going to talk to a counselor to find out the pattern or the problem which has led you to be like this. I will tell you right now, Dr. Yemi. So number 1, CBT. Number 2, we can also offer you a variety of medications. Anti-Depressant Therapy. What are these medications? They are medications which will block the neurotransmitters in your blood, the chemicals in your brain, and like ease the symptoms of depression. For how long should I take them? Usually, you will tell her that you will start working within 6 weeks, and we recommend that our patient takes them at least 6 months, so that they become stable. So 6 months at least. We can give you 1 or 2 drugs for that. Do they have any side effects, doctor? You will tell her that usually their side effects are temporary, but sometimes they can cause some dizziness sometimes. This is the most important side effect. For that, in the beginning, you should not operate heavy machinery and do not drink alcohol as well. This side effect is temporary. Meanwhile, you told her about CBT and medications. Now advise her about to socialize, to be socially active, to involve herself in social activities and leisure time. Try some swimming classes, try some sport, because this will definitely boost her mood. What about her weight loss? Usually her weight loss is due to the loss of appetite, which is due to depression. So definitely when you are starting your treatment, your appetite will be regained back again. This is very simple. How to differentiate this from chronic fatigue syndrome, Dr. Yemi? In chronic fatigue syndrome, it's called fatigue, which means tiredness. So the presenting complaint is tiredness. But in the depression, usually the weight loss is due to loss of appetite, which is due to, when you lose appetite or when you are feeling low, you are having loss of appetite or weak appetite. So this appetite or this loss of appetite is due to the depression or the low mood. Okay, but the fatigue or the tiredness is due to something else. It's usually due to minor illness which happened a few weeks back. Okay. So
should we ask?
Yeah.
Okay. In the differential diagnosis, when you reach to the other, how is your mood? Your mood is low, so have you thought of committing suicide? So when we diagnose the patient as depression, should we ask these questions? CAPS, sleeping, concentration.
Very good. You can also ask about other symptoms of depression as well. When you ask, you can ask about. When she tells you the mood is low, you can ask about the associating symptoms as well. This is a good point. You can use it here as well. But in case that you do not have time to address that, you can only ask about the famish and these things, and you'll pick it up from the history. But usually, don't forget that this station is medical and psychiatry at the same time. And usually, the girl will not open up to you, so you'll be taking too long history to rule out medical conditions till you reach the mood. So if you do not have much time, you can ask only one symptom from depression. She told you she's feeling low.
Yeah.
Ask her maybe you feel tired, you feel sleepy. How about your sleep? And how about, she told you, by the way, she's losing appetite. So this is one symptom of depression. And she's feeling low. So feeling low and low appetite are very enough. But if you want to ask 2 more symptoms, do you enjoy your life again? Or for example, do you have enough sleep? Or what about your sleep? Those 2 questions are very enough.
Yeah, you're right, but let me. I just want to deliver my point.
Yeah.
Because what they are doing in the real practice, they ask about the depression screening, about the depression questions, and then they will ask about the question of the mania, because they don't want to elaborate, or an anxiety symptoms, because this will.
Sorry. Mixed anxiety. This depression.
Yes. Yeah. because there's really importance to differentiate between depression and anxiety. And if it is depression, so we need to rule out also the bipolar. If we give this according to the to a theory, if we give this medication antidepressant, so this one's gonna be, it might consider not safe.
Okay,
say
that's a good
I'm
point.
not sure. I don't know actually. I haven't. Yeah.
No, that's a good point. But the important.
But this one, I think it's supposed to graduate. It's supposed to graduate things.
No, it's not about postgrad. It's about just you are taking still medical history, and your time will not be enough for this. That's what I'm saying. And she's giving you that she's feeling low all the time. She doesn't have any episodes, like she does not enjoy anything. She does not do anything else. Do you think someone who has been losing weight could she be maniac? I mean, she's losing weight in the past 3 months, and she did not have any other symptoms, like for example, no hyperactivity or no. Your point is very good, but the thing is that you still have to take medical history, and after taking medical history, you have only to elaborate the low mood. In the bipolar disorder, usually she will give you a clue. She will tell you, doctor, before that I used to be very nice and I used to be very active, and even these things. But I cannot even diagnose, by the way, the bipolar disorder from 8 minutes. You know this? So that's why I'm telling you, for example, in the delusion station, some examiners are pissed off.
That's true. We have
some examiners are pissed off because you say delusion disorder after 8 minutes history. Some examiners are pissed off that. So anyway, you just elaborate the depression, and you now know that the depression is the reason for hair weight loss. To prescribe the medications, actually, you will still do some further medical examinations, and you will take detailed psychiatric history as well from her. And generally, she's having depression, which is the cause of her loss of appetite, or the low mood. Or the depression, which is not only low mood, sorry. Depression is a cause or a condition in which there is a decline in all the functions in the body. Usually it happens due to low mood, but its effect is prominent on other systems as well. Yeah, Dr. Muniba, the task only says that there is weight loss. This is the only problem. And how, by the way, how to differentiate between the anorexia nervosa and depression? Both are weight loss. How to differentiate between them, anorexia and depression?
Over there, it is intentional.
Anorexia is intentional, yes, but depression is not intentional, right?
Yeah.
Very good.
And patient doesn't accept that she's losing weight?
Exactly, no insight, you mean. Yeah. Very good.
I think in the PLAB, they don't bring us, I know this one, vague scenarios.
Which ones?
This means that, because looks in the, because I know I don't want to divert you to another, because in real practice, we can face also bulimia or Anorexia Nervosa, even in the,
yeah, sure. Yeah. Binge eating.
But
this,
but I think in this one, weight loss, it's mean that depression. I think this is the case.
Yeah, it's depression. It's definitely depression. She doesn't have any eating disorder. The problem is only that she is losing weight because she does not enjoy her appetite, because she's feeling low since her breakup. This is the only thing. You can take some family history, as I told you, and you can also take, if you want to take, or if your time will let you, you can take some psychiatric depression associating symptoms. It's very fine. But the important thing is the management here. When you say the management, you have to say that we have to run further investigations to confirm or to find out the cause. I would say that if the investigations came back normal, this means that you're having depression. Okay, yeah, anorexia, inside Dr. Muniba. Let's speak about anorexia. So the management here, Dr. Yemi, will be number 1, CBT, cognitive behavioral therapy. Number 2, medications, antidepressant. She will likely take it for 6 months at least. The improvement will be started from 2 up to 6 weeks. They start working after 2 to 6 weeks. The improvement should be shown within this time. And the side effect is that they may show her or give her some dizziness, for which she is advised not to operate any heavy machinery nor drink alcohol. Okay, for how long? You told her you recommend 6 months. What else you can tell the patient is that you will advise her to socialize and to be socially active. Okay, next station is anorexia nervosa. This depression station, don't worry about it because it's seriously easy. You need only to know that we need to run further investigation to rule out the medical cause, and we will give the psychiatric treatment like anyone who's having depression, CBT, and medications. Okay, now let's move to the anorexia nervosa. In the anorexia nervosa, simply, this is the longest psychiatric station. Longest, really. So when you enter the cubicle, you are FY2 either in psychiatry or in GP. We can bring you both. Let's speak about GP because it is the long one. In GP, and most of the time she is referred from her GP to you. But if you are in GP, I mean, if you are the first one who sees her, she will tell you, doctor, my family, why did you, how can I help you? Doctor, you can't help me, I'm fine. It's just my family have some concerns about me. Well, I'm glad that you're fine. Can you share your family concerns with me about you? She will tell you, doctor, actually, you know, my family, they think I'm losing weight. Then she will lose eye contact with you. If she doesn't want to open up to you, or if she does not want to speak to you, please reassure her. Tell her that please feel free to share with me whatever you wish. I'm not here to judge you nor to cast you out. She will tell you that when you ask her, for example, why do you think or why do they think that you're losing weight, uh, she will tell you, doctor, because I have been losing weight in the past few months. And what do you think about what you say? I think they are right. So again, why do you come here? Because my family has some concerns about me. Which concern? They think that I have been losing weight. And what do you think? I think they are right. No, she will say, I think maybe they are right. Maybe. She will say maybe. So maybe means here that she's not convinced. She's not convinced, or she can reply to you in another way. She can tell you, doctor, what I think is healthy, that I'm losing weight, I'm following healthy, balanced diet. Why should I worry about anything? So she is very stubborn and she does not believe that she's doing or she's having any problem. Okay, so it's important to ask her, and may I know what you think? She will tell you, doctor, I think, no, I think it's fine. I'm eating healthy, balanced diet. Or she can tell you, maybe. She can show you that she's not caring, which means that she's lacking insight, right? Okay, now ask questions. You know, guys, I have a very good approach to this station. Please write it after me right now because you will never forget about it. You will tell her, I'm going to ask you a few questions regarding this weight problem or this weight loss. Number one, when someone is losing weight, uh, probably this can be because of their diet. No, before of the diet. Ask her, may I know for how long they think that you have been losing weight? Okay, no need actually to ask her, have you ever planned or not? Because she already plans to lose weight, and you know from her talk. So for how long have you been losing weight, as they say? She will tell you, doctor, since 3 months. Okay. Now, when someone is losing weight, we need to ask them a couple of questions which can lead to this weight loss. What questions? Number one, the diet. For example, tell me about your diet. What you want to know, doctor, about my diet? Uh, what do you eat? Doctor, I eat healthy, balanced diet. She is very stubborn, I told you. Okay, can you be a little bit specific? Like, for example, how many meals do you take? She will tell you, doctor, I take 3 meals. Can you be precise, like tell me in what you eat in each meal exactly? So she will tell you that she is taking fruits and vegetables all the time and drinking water and this thing. Definitely, she is not eating proper meal. So number one, I ask about the diet, which is the main reason for any weight loss anyone can be having. Number two, I need to ask her one important thing. When we eat too much, we tend to do some other things. Like what? Sometimes when we eat too much, we tend to play sports to burn what we eat. So by any chance, do you play sports? Yes, I'm doing regular exercise. Great. Which exercise? She will tell you that she's doing aerobics. Since when? Since 3 months, doctor. Okay, when we play sports, we need to always to measure ourselves in front of mirror or measure our waist and look in the mirror. So by any chance do you do this? You check your body regularly? She will tell you, yes, doctor, I do check my body regularly, definitely, especially after playing sports or after playing exercises. This is number 3. Number 4, sometimes also we need to take or we be tended to take some medications to lose weight in case the sports don't help us. Like what? Do by any chance do you take any fat burner? No. So she does not take any fat burner, nor any water tablets. Okay, so number 4 is the drugs that we can take. Number 5, which is very important as well, you will ask her, for example, how is your mood recently? May I know how is your mood? Because sometimes the mood can be due to, or the loss of appetite can be due to the mood. Loss of appetite can be due to mood. Do not overlook this. So ask her about the mood right now. How is your mood recently? She will tell you it's fine, doctor. Okay, that's great. Now ask her, you know, when people do, now she have done everything to lose weight, still she can be not satisfied. So tell me, do you have any preference to your clothes? Why? Because if she thinks that she is not able to lose weight, she will tend to wear loose baggy clothes. Loose baggy clothes. So by any chance, do you have any preference to clothes? She will tell you, yes, doctor. I prefer wearing loose baggy clothes. May I know why, or may I know, or do you feel that it's related to your weight? She will tell you, yes, doctor. Definitely, she wears these clothes because she thinks herself. Sometimes, some people say that because she thinks herself fat, or she wears them because she thinks that she has lost much weight and she needs to lose always weight. So simply, she's preferring the loose, baggy clothes. Okay, loose, baggy clothes. You know, this means that she's ashamed of her body. So ask her, do you like your body the way it is? Do you feel that you will look better if you are thinner? Yes, doctor, I do feel so. And do you feel that the people will like you if you are more thinner? Yes, doctor. May I know if there's any particular reason for that? She will tell you, yes, doctor, because I want a boyfriend, like my friends. All her friends are having boyfriends, so she wants a boyfriend. So, again, from the start, diet. Number 2, sports. After the sport, we stand before the mirror or we check our waist. After we fail losing weight through the sports, we do take drugs or medications, fat burner or diuretics. After the drugs, usually, after everything fails, we tend to wear baggy clothes to hide our problem. When we hear baggy clothes, it means that we are insecure about our body. So what we can do, in this time we tend to feel low or we tend to not like our body and we feel that we are looking more beautiful if we are going to lose weight. And people will like us more when we lose much weight and we are thinner. Why do we do all this? Because she is having one concern. She wants a boyfriend. In the end, you can ask her, may I know if you have any role model? She will tell you, yes, my role model is Gal Gadot. Gal Gadot from the Wonder Woman. So Gal Gadot has caused her this problem. Okay, so you elaborated everything in terms of the weight loss, right? Right. After that, we asked also about the mood. Now you can ask normal psychiatric question, but before asking psychiatric question, it's better to take some medical history. Like what? Ask her, do you feel tired in the past few days? Do you have any heart racing? Do you have any trouble sleeping? Those are the problems which can be associated with acute weight loss, like in short-term weight loss. So, should you feel tired? Are you able to concentrate? What about your sleeping? Like this. So now you took some medical questions that's treating symptoms. Okay. Number 2, You can also ask her about some past medical history. Do you have any medical condition? Do you take any medications? No. Number 3, ask about the lifestyle. Do you smoke? She will tell you, yes, doctor, I do smoke. It's very important to ask her here, when did you start smoking? She will tell you, I started smoking maybe 3 months ago. So basically, she started smoking because she thinks that the smoking is helping her to lose weight. Okay, what about alcohol? Can be social drinker. Diet, we already asked about it, and physical activity, we already asked about it. Okay, she is a female, and the anorexia nervosa can affect the periods as well. You know, when someone is not eating well at all, there can be some menstrual irregularities and very low or like this flow. So ask about the periods. When was the last one? Is it regular? Sometimes she can tell you that there were absent periods. She will tell you definitely that there is low flow. Okay, she's low flow and since 3 months as well. Why? Definitely because of her like poor feeding. So you ask it now from the medical history, associating symptoms to the weight loss. From medical history, okay. What are the associating symptoms of weight loss? You can ask her about shortness of breath, any tiredness, any problem with sleeping, any heart racing, like the anemia symptoms exactly. And past medical history, you are going to ask her some past medical history, like 2 or 3 questions. Now you're asking about lifestyle and then about the period. So you finished your medical history. Now move to the psychiatry history. What is the wrong or what is this strange information that we made to the anorexia nervosa? Because number 1, in the anorexia nervosa, you have to explore the psychosocial. You have to explore the reasons which have caused this. Anorexia nervosa has specific pattern of behavior that we need to ask about, which we spoke about in the beginning. Diet, and then sport, and then body checking, and then medications, and then loose baggy clothes, and then body comfort or body shame, and then role model. After that, you can take medical history, as we said. Now, psychiatric history, the famish. Famish, very important as well, to see if she's supported by her family or her family are scolding her or not. As you can ask about the mood here as well, if you did not ask about it, mood and suicide. Now please move to the management. If you are a GP, you have to examine her carefully. Which examinations? Total body examinations. And which investigations? All initial investigations, including some CT scan as well, and ECG. Because actually, a long-term anorexia can cause heart racing and tachycardia, and she can end up having AF. Because she's going to have like good anemia. So what's wrong with me, doctor? You're having condition we call anorexia nervosa. What is this? It is a condition in which the person tends to keep their weight as low as possible because they think that they are overweight or they need to lose more weight. Doctor, is it my mistake that I need to lose weight? I eat healthy food. Is it wrong? You will tell her, I'm glad that you eat healthy, balanced food. But in your case, actually, you are not taking healthy, balanced food. Or your weight loss can be serious to your health because you are losing much weight, more than you should do. So you will tell her that her weight loss is on the higher side. One thing we forgot here is that when you are seeing the examination, do not forget to mention the BMI. Because the BMI is the clue here. BMI usually is 17.5 here, and by the way, it's given in the task. BMI is 17.5. So when you are telling her, doctor, is it wrong that I'm maintaining healthy balanced diet and I'm maintaining healthy weight? So you will tell her that we have measured as well your weight in relationship to your height and it was in a very low side, or it was low. Moreover, such weight loss can cause some troubles or some complications in your health. Which complications, doctor? What are the complications of anorexia nervosa? Number 1, anemia. Number 2, osteoporosis. Number 3, kidney failure or kidney problems. And also it can cause some heart problems, like maybe heart racing or arrhythmia, which lead to heart failure in a while. Thyroid problem as well. It can cause hair to be infertile if this ever happens. And ultimately, she can cause some strokes to hair because this will affect the clotting factors and the protein in the blood. So again, anemia, osteoporosis, some heart problems and some brain problems and kidney and liver problems. What are you going to do for me, doctor? Now we will speak about the treatment plan in this case. What is the treatment? If you are a GP, you refer here to psychiatrist. Psychiatrist will offer here again, number 1, CBT. Number 2, family therapy to gain her family support and also to support her in this. Number 3, he will offer her some diet plans. Diet plan, why? To gain weight safely and gradually. Gain weight safely and gradually. This is proper diet plan. Diet plan. Number 4, they will offer some medications, like for example some antidepressants or some sedatives actually to deal with the problem which can be associated with anorexia nervosa. So again, CBT, family therapy, diet plan, and medications. This is the whole story. Anyone has any questions so far? Because we are going to run to the counseling right now. Counseling stations are quite similar to each other, and we should not spend too much time in them. And the counseling, you will enjoy it as well. I mean, the ethics were hard. I know that ethics were hard, and many people were confused a little bit.
Dr. Ahmed, what is the admission criteria for anorexia nervosa? Some people are asking about BMI, if it is less than 17, BMI less than 15. What is the exact admission criteria for an
Actually, if the BMI is lower than 17.5 or 17.5, this means that she should be admitted to a clinic. I mean, eating disorder clinic, or she should be referred to eating disorder clinic. But if it is lower than 15 itself, so between 15 to 17.5, you will refer to clinic. But below 15, you will admit in the hospital because she is critical.
And again, admission in medical unit or psychiatric unit, because if it is less than 15, she will be having some electrolyte problem and medical problem. So
eating unit. It's called eating unit. I told you it's called eating unit or eating clinic. Eating disorder clinic, yeah. And below 15, she will be admitted in the hospital because this is health problem.
Yeah.
One important thing is that you also attend a psychiatry station, so you should see if she's having associated depression or not, or if she is having associated suicide or not, or about her family or not. Because sometimes if she is likely to recur again to this problem, you may need to admit her, even if her BMI is high, or if she was suicidal as well, you can admit her. So here, basically speaking about the anorexia, in this case, she does not need admission. She just needs further management or further investigations upon which you will decide in the management plan. Okay.
Thank you.
You're welcome. But by the way, this station is very long. Okay, so try guys to cut it short. Like try to correlate it with each other. Like for example, as I told you, diet. After the diet, we play sports. After playing sports, we check in the mirror. Your anorexia history should not take you more than 2 minutes. And after that, you can take some medical history in 1 minute, and then family history in 2 minutes as well. So 5 minutes for the history. 5 minutes for the history are very enough, or even 5.5, ultimately 6 minutes. But if you ask about each and everything, you will end up finishing after 6 minutes, which is quite harmful. Mind that she is very stubborn and she is not willing to stop losing weight. Why don't they drink alcohol? She can drink alcohol sometimes, but I told you she can be social drinker. And she is a heavy smoker. She started to be a heavy smoker as well, because she thinks that smoking will help her to lose weight. Eating disorder clinic. Eating disorder clinic is something like psychiatry. It's part of psychiatry because eating disorders are part of psychiatry. This is when her weight is below 15 to 17.5. But if the weight is below 15, this is a problem. This is a health problem. So she needs to be admitted in the hospital. Okay, let's move to the counseling stations. Counseling stations, we are going to discuss first of all, actually, I need to tell you one thing. If you do not follow the approaches I told you in the counseling, you are going to suffer in the counseling session seriously. Because many people, they are only having one complaint in the counseling station, which is how to manage it or how to follow it. This is not the counseling stations, guys. Counseling stations are all about your approach. How your approach. You need to follow certain approach, which I said in the record and which I'm not going to repeat right now, because I sent the record many times and we spoke about it in the introductory session. And I know that some people did not hear it or read it, and they will stop me in the middle to ask me how to move from this and that and how to do this and that. This approach applies to all the counseling stations. And if you read the script, this is harmful to you. You only need to pick up the risk factors from the script. Like, for example, any stroke, you have to pick out the risk factor of hypertension, the age, the family history, cholesterol, high blood sugar, and weight, high weight. Those are the risk factors. So this will be your core of the station in the cardiovascular disorders, like hypertension, heart problem, and stroke. Let's speak about the today's stations, the counseling stations. Which stations are we going to discuss today? Number one, let's start with something interesting, which is the osteoporosis. In the osteoporosis station, let's read the task. Okay. In the task here, you're FY2 working in surgery department. The patient has come here because she needs to receive her test results. She has done some DEXA scan. Why? Because she has had a fall 1 year ago, after which she had a fracture, for which she had a surgery. After the surgery, she came like 1 week ago to remove the pin, and she has done some DEXA scan. So here she is here to receive the result of DEXA scan. Talk to the patient and address her concern. Okay, so now you disclose. Now it is test result counseling station. Again, number one, reason for visit. I'm here for my test result. Why did you do this test? Doctor, she will tell you the whole story of the fracture and the fall. Now, ask about current condition. So reason of test. Number two, current condition. Do you have any pain anywhere? Any swelling anywhere? Are you able to walk? Yes, doctor. Okay. She will insist on you to tell her the results. This means that you need to disclose the results right now. Because she insists on you more than once to disclose the test result. So you will tell her that your test results show that you are having a condition we call osteoporosis. Do you know what is this? What is this, doctor? It is a condition which we call it thinning of the bone, loss of bone density or low bone density due to loss of some minerals. Oh my God, doctor, why did it happen to me? Now you have to take some history from her. So let me ask you a few questions to find out the cause or the risk factor for you developing this. Okay, doctor, ask me. So now we move to the test disclosure because she pushed you toward it. It's very important. Now, Which questions you should ask? We should ask here about the risk factors for developing osteoporosis. Can anyone tell me in 1 minute what are the risk factors for developing osteoporosis? Anyone can elaborate it, just in 1 minute. Instead of sleeping, tell me everyone. I need someone to elaborate, someone to be active. Dr. Zaid.
Okay, can I ask you a question about the menstrual cycle?
Dr. Elvira are next. Tell me, Dr. Zaid, yes.
Okay, tell me, how was your menstrual cycle? And when the last time you had the menses? And number one question. Number two question is, do you have any medical problems? And have you done any surgery before? And what about, do you smoke? Do you do exercise? Do you drink alcohol?
Yes.
Any family history of the similar problems before?
Perfect.
What about the diet? What about diet? What do you eat? Do you take any supplement?
Perfect, Dr. Zaid. Perfect. Seriously.
Yeah.
This was perfect.
I got 9 in this question. This 9.
That's perfect, seriously. The thing is that the osteoporosis are having some risk factors. So from the PMH, or the past medical history here, is to pick up the risk factors, which are, from the task, you know the age of the patient. So you know that she's already at high risk because of their age. That's number one. Number two, my mission is to ask about the past medical history to figure out the risk factors. Number one, do you have any medical condition? Any bone problem? Do you take any medications? She will tell you, yes, doctor, I'm taking hormonal replacement therapy. Yeah, know why? Because she has removed her surgery, and she has removed her ovary and uterus 20 years back. So she had previous total abdominal hysterectomy, and she's taken hormonal replacement therapy. So the surgery is one risk of developing osteoporosis. Why? Because due to low hormones, low estrogen, and consequently bone thinning. Okay, so number one, age. Number two, the surgery. So do not forget to ask about surgery before. Do not forget to ask about surgery in this station. Number three, family history. Very important to ask. She is having family history of osteoporosis. Her mother developed osteoporosis. Okay, okay. After that, move to the lifestyle. In the lifestyle, you smoke, you drink alcohol, are you physically active? What about your diet? Here she smokes, she drinks alcohol, but in moderation. And in the physical activity, she plays swimming. Doctor, I'm physically active. I play too much swimming. I love swimming too much. Encourage her. Please encourage her when someone is telling you something positive. And tell her that's great. After that, what you're going to do, ask about the diet. I eat healthy, balanced diet. Can you be a bit more specific, please? She will tell you, doctor, I eat fruits and vegetables, and this. Do you take any milk or dairy products? No, doctor, I don't like them. Okay, that's fine. So now you picked up one risk factor. So the risk factors are smoking and physical activity and diet. So doctor, what's wrong with me? Now you can examine her legs, but the examiner will tell you do not examine. The risk factors. There are some risk factors which can be changed and some others which cannot be changed. Your age and family history and your surgery are some things we can't interfere with. However, there are some other things that can change regarding your lifestyle. For that, actually, we are going to provide you with something that you can do and some other things that you can do. Guys, in any counseling station, always open. There are some things that you can do and some other things that you can do in any counseling. What would you like me to start with? She will tell you, doctor, tell me what you can do. You will prescribe here bisphosphonate and calcium and vitamin D supplements here. She will ask you what's bisphosphonate, as we said before. It is a medication to strengthen the bone. Okay, it has to be taken early in the morning every Sunday, and you should sit upright after it for 30 minutes. Okay, and you should take it with a glass of water. Okay, doctor. Are there any side effects? You will tell her some tummy upset, and it sometimes can affect your jaw. Vitamin D and calcium supplements are important to strengthen the bone as well. What I can do, doctor? You'll advise her about number one, smoking. Smoking can weaken the bone as well. So you'll advise her about smoking cessation, and we are going to refer you to smoking cessation clinic. Alcohol, it's advisable to drink in moderation. Do not ask her to stop alcohol. Drink in moderation enough. Number three, physical activity. She plays swimming, but swimming is cardio exercise. It's not weight-bearing exercise. You'll advise her about weight-bearing exercise. Like what? Like walking, like jogging, like climbing the stairs, or doing some gym training. So you just swimming is cardio. It's good for the heart, but not for the bones. Any exercises for the bones are the exercises in which you are standing or walking, because you weight bear on the bone. In the end, you will tell her about the healthy, balanced diet. You told me that you do not take dairy products. Actually, we do recommend taking dairy products, but if you are confused, we can refer you to a dietitian to set you a proper diet plan which matches your needs. Keep this in your mind always. These things, smoking, diet, alcohol, physical activity, are very important to speak in any counseling sessions. We already all know about them. Smoking, advice about stopping smoking. Alcohol, drink in moderation. How to moderation? 14 units per week. 14 units per week are enough. Then diet, advice about healthy balanced diet including dairy products and milk here. And physical activity, weight-bearing exercise. This is a station so far. A very easy station and very nice one. Again, in any counseling sessions, you have to start with some things that we can do and some other things that you can do. What would you like me to start with? She will tell you, doctor, start with anything. Now, start with the things that you can do as doctor, because it's just short and you are taking good marks for it. After that, move to the lifestyle. Speak about smoking, alcohol, diet, and physical activity. Okay? Has anyone got any questions so far?
How important, like for the follow-up and safety rating sentence should be included, isn't it, Emma?
Yeah. You can
All
also,
the counseling sessions always follow up when
yeah.
I want to see you again, and then safety rating in between if you get this thing. Immediately. Right?
Yes, that's true. But here, what will be the safety netting? You are going to tell her if you feel that you are going to fall? No. You just tell her that it's advisable to take these medications regularly and to follow this lifestyle advice regularly. Because, osteoporosis is not a disease which is having like complication. The only complication is having a fall for
Yeah.
osteoporosis. But you're just advising her to take the treatments regularly and this and that. I mean, usually in this station, there is no warning signs.
No.
But in other stations, like what you see right now, like the stroke and the vascular dementia and the cholesterol and these things, actually you are going to give, it's very important to give safety netting and warning signs due to the implications, like the cardiovascular disease and this thing.
And one more thing, brother.
Sure.
Whoever
By
needs
the
to
way, your
mention
voice
about
is far a little bit. Yes, again?
if you don't know the specific time, like when to follow up that person, can we say you need to follow up with us regularly?
Do not mention any time in that too. It's
We need
better
to
not
say
to.
just follow up with us.
Yeah.
Follow up with
You
us
need to
regularly.
follow up regularly. Better,
Okay.
please, better. Do not mention any time frame in that too. Why? If you know it very well, okay. But if you are not sure, do not mention it. They can consider it as wrong information, and you don't know how he will mark it.
Okay.
Leaflets, Dr. Kashi, it's very good to offer leaflets to anyone in counseling stations. You can offer leaflets about the diets, you can offer leaflets, but I mean, speak a little bit few lines. For example, tell her it's important to maintain healthy, balanced diet, including dairy products and calcium. And for that, we can refer you to a dietitian to set you a proper diet plan which matches your needs. We can also offer you leaflets about the relevant problem. So it's good to mention the leaflets in the diet and lifestyle advice generally. Very important actually sometimes when you are running out of time, you can mention the leaflets, you can mention the dietitian, you can mention these things. But I mean, do not say them and stay still. No, speak some few advice about the diet, for example, and then offer leaflets. Speak some few sentences about smoking and then offer leaflets, like this. At least to show that you know. Okay, did you get it, Dr. Kashi? Okay. Now, let's move to my favorite station, Dr. Muniba. How are you, Dr. Muniba? Guys, please, no one leaves unless they inform me beforehand. Okay? I see that some people can be leaving sometimes without saying. Dr. Muniba?
Hi, I'm good. How are
Yeah,
you?
I'm not speaking about you actually. I'm just speaking about because some people can leave from time to time without at least tell me that you're going to leave, okay? Anyone? Dr. Muniba, tell me, regarding the epilepsy, you know the epilepsy, right?
Yeah,
What is the epilepsy, Dr. Muniba?
it well, it's an abnormal activity in the brain,
Okay,
abnormal electrical activity in the brain.
yes, exactly. What are the things that can trigger the epilepsy? I mean, the patient is already diagnosed with epilepsy. What could be the things which can worsen his or her epilepsy?
It could be loud noise, could be excessive
Number
light.
one. This patient is diagnosed with epilepsy and he is taking medication. What could be the
If the
reason?
patient is not
Yeah.
non-compliant to medication.
So number one, incompliance. Number two.
Improper sleep,
Okay, good. What else?
and excessive light, but of using more TVs and computers.
Perfect. What else?
Loud noise.
Perfect.
I don't know else. Sorry.
Dehydration. Skipping meals.
Diet also.
Dehydration, skipping meals. Computer screens.
Alcohol.
Yes, computers. Alcohol, no. Binge drinking. Just say binge drinking. Yeah. Screens. What else apart from the screens? Recreational drugs.
Yes.
Stress, simply, Dr. Kashi. That's right. So you are here having some variety of triggering factors. Yet you cannot say them in one go. Right, guys? What will happen if you say them in one go? If you escape from the GMC, you will not escape from me. Okay? Don't be happy that I'm going to tell the patient, actually, the triggering factors are number one, drinking alcohol, so please do not binge drink alcohol. And also one more thing, you don't sleep well, so please make sure that you sleep well. And also one important thing, strenuous physical exercises can lead to this problem. So please make sure that you don't do this because, you know, if you do this, you'll be, there are 10 triggering factors. If you do this, you will not gain, you will take at least one in the management. You will take ultimately one in the management. What is the use of telling everything without checking his understanding? What will he gain from you then? What did he learn from you? Okay, Dr. Maria, no excuses. You will not leave. Dr. Ofuli was asking one question, is that in counseling stations, we offer leaflets at the end. What if history taking stations that are not emergency? Like what, Dr. Ofuli? Tell me your opinion, or tell me your thought here. Tell me.
Like what I'm trying to say is, most times they say at the end of most history stations, and there are not acute cases or like seaman cases or acute cases, and then you've addressed the management, and then you have towards the end of the management you have time, you can then offer safety netting and then offer leaflets.
Yeah.
There's a mark for leaflets because every hospital.
No, wait. In most of the history-based stations, there will be safety netting for the relevant condition. But in the lifestyle, I mean, in the history-based station, you will not have too much time to speak about the lifestyle. You will barely address the smoking in the history-based stations, because don't forget that the management will take you at least 2 minutes. So the management itself will take you 2 minutes, and if you are ever left with few seconds, you can warn about the hypertension or the smoking or whatever. but you will not have time to reach leaflets. And if you have time, this means that you are exceptional, or the GMC added to you maybe 1 more minute.
Okay.
No, I'm not kidding seriously, because many people are asking me like, you know what, Dr. Fidelity? 2 days ago,
Okay.
I watched it on one, I saw really on WhatsApp group, one of WhatsApp groups, someone who, wait, let me stop the recording because some people may consider that I'm the favorite. So for the epilepsy review, you are going to ask the patient, and you will tell the patient when were you diagnosed and how is it managed. He will tell you that, doctor, they
Yes.
prescribed to me some medications. Okay, have you been taking them regularly? He will say, no, doctor, actually. Is there any particular reason? Doctor, they give me some headache sometimes. Okay, and how is your epilepsy? He will tell you, doctor, actually, I got some fits, 2 fits in the past 3 weeks. When was the fits? One was 1 week ago, and the other one was 2 weeks ago. So definitely the patient is telling you that their epilepsy is not well controlled because they have got 2 fits after discharge with medications. Okay, ask him more about the fits. Can you think of anything which brought these fits? He will tell you, doctor, I don't know. I was just in a party with my friends and we were drinking, and suddenly I developed these fits. Now you will tell him that the epilepsy is not controlled because of, this is your history here. You can also ask some medical questions like, do you have any other medical condition? Do you take any other medications? Do you have any allergy? Did you have any infection recently? Ask him about the lifestyle, smoking, alcohol, and physical activity as well. And now we will tell him that you have been prescribed medication. This is sodium valproate. You told me that you didn't take it. Or he can tell you that he took it only when he has fits. So now you have to tell him that this medication should be taken regularly, twice per day, as prescribed. He will tell you, doctor, why regularly? Because it acts by building the level in the blood. Once it reaches normal level or certain level, it will build up a protection against the epilepsy. Okay, doctor. So you told me that he's having headache. Actually, headache is one of side effects. At this point, you can open the BNF as well. So I told you in the medications, in any medications in the counseling station, you have to open the BNF. Hello guys, I'm sorry, there has been some problem. I don't know what's the problem. The meeting has ended suddenly. Sorry, Dr. Masi, sorry. Can you hear me now, everyone?
Yes, brother. Yes,
So,
yes.
okay. So he will tell you, with any medication, you have to speak, number one, about the compliance and the frequency. How much should he take and how often should he take? Number two, you have to speak about the side effects. What are side effects? He told you one of them, headache. Now you can open the BNF to check the other side effects. Or if you don't have time to check the BNF, you will tell him the side effects. And after that, I will also check with my BNF or with my book. So say whatever you want to say, and then I will also check with my book. What are side effects? Headache. You can prescribe some simple painkillers. Weight gain. Stick to healthy balanced diet. Hair loss, it is usually temporarily. Okay, this is number 3, side effects. Number 4, drug interactions. You'll always advise not to take other drugs unless after seeking medical advice, because it can interact with some drugs. Okay, this is a medication which was one reason for the uncontrolled epilepsy. Number 2, the trigger factors. In any disease, to bring it or to worsen it, you need incompliance with the drug and some triggering factors. What are the triggering factors? He told you that he was in party. So by any chance there was any loud music or loud noise or flashing lights, he will tell you, yes, doctor. So these are one of triggering factors. So you advise him that it's advisable to stay away from these things because they can bring effects. Number 2, you were drinking alcohol. Were you binge drinking? He will tell you, yes, doctor. It's advisable to drink always alcohol in moderation because too much alcohol can bring the fits. Number 3, did you stay up till late night? Because lack of sleep can cause effects as well. He will tell you, yes, doctor, you were staying till late night. So lack of sleep can present effects, so it's advisable to have proper sleep as well. Then, other triggering factors like what? Stress. Abstain from stress. Okay, Dr. Safa. What else? Strenuous physical activity. Always try to have light physical activity or light exercise. And if you are going to exercise, do it with someone who knows about your condition. Then, recreational drugs. He doesn't take any recreational drugs. Dehydration. It's always advisable to have bottle of water with you because lack of water or lack of fluid can precipitate the fits. Skipping meal. Skipping meal is one of the triggers for having this, so it's advisable always to eat regularly your meals and not skip meal. What else? Sitting for long in front of screens like laptop or computer, like what we are doing right now. This can present fits. So it's advisable to take breaks or use protective screens in front of the laptop. This is good. This is great so far. This station actually has been divided in a way that everyone here can remember it. I need you to sum it up into two compartments. Number one, elaboration of epilepsy. Number two, causes for the uncontrolled epilepsy, which are number one, drug. Number two, trigger factors. After finishing the trigger factors, you will give him some more warning signs and safety netting. What are safety netting? We will provide him with a bracelet for his epilepsy. This is sort of identification. This is number one. Number two, it's always advisable to to have shower rather than bath. Okay, and to use electrical based techniques or electrical based devices rather than heat devices. Okay, those are the safety netting. What are the warning signs? You will ask him whom does he live with, because you need to warn his family about his condition. Because in case he develop any of these fits, they will tell him to keep him in the recovery position with head tilted backward on the left side, his head tilted backward, and to not put anything in his mouth and to remove any sharp objects from around him. Okay. Doctor, will I take this medication so long? It's advisable and it's better, and actually usually patients will stay with these medications. However, sometimes after some time your medication or your condition can be well controlled and you may not need them. This can happen sometime. Important thing, driving as well. Should I drive? The DVLA recommends to stay away from driving for 1 year till you are symptom free. So when you are 1 year symptom free, you can go back to driving again. So again, the triggering factors, after the triggering, identity form and electrical and some safety netting like electrical stools or electrical based devices, and shower rather than bath, and then teach the family about how to deal with the fits in case they happen, and then the driving. This is the station so far. Has anyone got any question in it? It's tailored always according to the patient, but listen, the safety netting and warning signs, you can say them. The only concern that he is having is a DVLA. This is the only concern. And he even can help you how to prevent these fits from happening again. In case he asks you how to prevent these fits from happening again, you are going to ask him to take the medication regularly and avoid the triggering factors, and as well to take some home measures like what? Electric substance rather than heat. Okay, that's it. So here, the only concern that he's having is a DVLA. Otherwise, you can speak about everything. Anyone has got any further questions here? Please, if anyone has any question, do let me know. Chronology like what? No, tell me. Dr. Mahdi, tell me what you mean by chronology.
Hello, Dr. Ahmed.
Yeah.
Actually, for the epilepsy patient, we have to address a lot of concern, like we have to safety net for a lot of matters. But should I follow any chronology or any sequence for that, or should I tell anything at first or second, third at my own wish?
No, wait. You mean regarding your safety rating and warning signs only, or regarding the station?
Regarding the safety rating and warning signs only.
Regarding safety rating and warning signs, what you can do is that only you can tell them about number one, you're going to talk to the family to prevent to know how to deal with further this. Number two, you are going to give him some precautions like electric stools and the identity form. Number three, he will ask you, now you are done. He will ask you after that about the DBLA. This is not chronological. Nothing chronological here actually. The safety rating and warning signs are usually, how to say, like, safety rating is actually what to do to prevent this from happening again. Warning signs are what if this ever happens again, what you will do. The safety rating here is the identity form and the electrical stools or electrical device to prevent this from happening again. And what if this ever happens again? We need to talk to your family to know how to deal with it. That's why you're going to do that. But nothing in sequence, no proper sequence here, no problem. Just the important thing is that after finishing the trigger factors, now your job is done. But you can also warn him about this recovery position. This is the important thing. By the way, this guy is this guy is a very nice guy, and it is one of the easiest stations that you can pass. And score high, by the way.
Brother?
Yeah, sure.
Isn't making the patient aware of the risk factors of the triggering factor a part of safety netting?
Sorry, risk factors?
Like we are making the patient aware of the triggering factor, that if this thing happens, you need to be like refrain from that thing. So isn't this a part of safety netting?
Okay. Safety netting here is that if this thing, or how to prevent this from happening, like for example, let me tell you one thing. The triggering factors here are core of this disease. And actually they have caused him to have this problem before. They were a reason for his fit before. So this is an issue. This is part of your management. This is part of your acute management here, or a part of your acute follow-up. Safety netting, usually, Dr. Masih, when you are speaking about them, you are going to tell the patient it's always advisable to take these medications and avoid the triggering factors, and avoid electric-based and avoid bath. Those are safety netting. So after speaking about the drugs and the trigger factors, you will say in the end, to prevent this from happening again, you need to take the drugs and avoid the triggering factors. This is the safety netting. What is the meaning of safety netting? Safety netting that the safety rule that you are putting to the patient to prevent this from happening again, or to prevent this condition from happening again. Okay?
Okay.
This is counseling station, don't forget about that. This is counseling station. This means that in the core of this station, you have to address the triggering factors. The triggering factors are not just safety netting, they are part of your management, the core of your management. Safety netting if they are not crucial in your management. If you can overlook them, or if you can speak about them in the end. But here they are core of your management, especially in the epilepsy, especially in what else, especially in some other stations as well that we are going to speak about. The triggering factors are core here. Okay? So basically, do not bother yourself and just after finishing the trigger, say what you wanted to say. Okay, let's move to the next 4 stations, which are quite similar to each other. The blood pressure stations. Okay. The blood pressure station, actually, I got it in my exam. It was actually the it was the Rrp station. In the Rrp station, he's coming for the hypertension review, and he has developed some cough. Definitely, the cough is due to Rrp. And what we need to do, we need to review the medication with the senior and change it into into losartan or valsartan, just angiotensin receptor blocker. 2 marks in this station. Number 1 or 2 notes. Number 1, you have to open the BNF. Very important. You have to open the BNF in this station. This is number 1. Number 2, take a good history, because the people go to the changing the medication without taking history. Okay. You will tell it it's hypertension review. So when you will ask him, how can I help you? I came for the hypertension review. Doctor, how was it managed? He will tell you, doctor, I'm taking Rrp, 2.5 milligram, for example. Are you taking it regularly? He will tell you, no, doctor. May I know why? Because, doctor, since I started taking it, I have developed a cough. Now elaborate the cough. Since when it started? How did it start? Has it changed? Was there any phlegm or in it or not? Was there any blood? Those 2 questions, remember, they were very particular for the cough. Now, ask him, and after stopping the medication, have you experienced any symptoms? Because this guy has developed cough, which led him to stop the medication. So I need to ask him right now about if he developed any symptoms of hypertension or not, because he is not taking the medications for the hypertension. So do you have any headache or blurry vision these days? Sometimes he can give you this, positive. When someone is having uncontrolled hypertension as well, they can develop some complications. Like what? Do you have any chest pain? What about any swelling in your legs? He will tell you, no, doctor. Now take another history, like past medical history. Has this cough ever happened to you before? How was your health recently? Did you have any fever or flu-like illness? Why? Because also you need to rule out infection. Do you have any medical condition, including chest problem? Any family history of similar condition? Any allergy? Move to the lifestyle. Do you smoke? Are you physically active? What about your diet? Alcohol? Because this is hypertension review, you have to ask about the lifestyle in details. Now examine the patient. Watch examination, you need to listen to the chest and measure the blood pressure. Those are the core. If you do not mention the blood pressure in the vitals, the examiner may not answer you. You will find the blood pressure is high and the chest is free, which means that the cough is side effect of the drug. And the hypertension is high or the blood pressure is high because he is not taking the drug. So now you will disclose to him and you will tell him that actually for my examination, it seems that your blood pressure is not well controlled or is a bit high. Do you know why? He will tell you, yes, doctor, I think because I stopped the medication. We'll tell him that's right. Doctor, but it has caused me cough. What can I do? You will tell him that actually the cough is one of the side effects of this drug. However, excuse me for a minute. I need to open my book to confirm that. So now you are going to confirm from the book. You're going to open the BNF right now. On the page of the Rrp, you will go to the index in the end and see the letter. You will find the Rrp is in the R section. Open the Rrp and you will find the side effects. One of them is a cough, dry cough. Actually, yes, it is one of the side effects of the medication. So, doctor, why did you prescribe it to me if it causes to me? Now you will tell him that it's one of the best medications that we prescribe for the hypertension. However, as you agree with me that side effects can happen with any medication. For that, we advise our patients to come for follow-up, and I'm glad that we received you today. So what are you going to do for me, doctor? We are going to, with my senior, I'm going to review your medication, and you will definitely, we can change it into another medication. Which medication? You can give him here losartan medication. What is this? It is another group of drugs which lower the blood pressure by another mechanism or another way. Are there any other side effects, doctor? Are there any side effects with them? You can open the BNF again. You'll tell him this will take you 10 seconds only this time because the losartan is 1 page before the Rrp or 2 pages before the Rrp. So you'll find that side effects usually are maybe postural hypotension, maybe some electrolyte abnormality as well. For that, we are going to follow you up regularly as well. Oh, okay, doctor. Thank you. Now you can give him some safety netting and warning signs. This guy has stopped the drug, and this guy is having uncontrolled blood pressure. So safety netting, you need also to take this medication regularly, and because actually having uncontrolled blood pressure can lead to some complications like heart problem or brain problem. What are the warning signs? In case you develop any headache or any blurry vision, or in case if you develop any chest pain, come back to us. Why? These are the complications of hypertension. So safety netting here could be that you should take the medication regularly. Wait. Which medications? Now we can speak about the ACE inhibitors. So again, guys, in this station, the only difference from the previous station is that you have to examine the ankle, and here you shift to the ACE inhibitor. And you're also going to add to him that we can shift you to another medication called diuretic. However, since you're having diabetes, we cannot shift you to this. We're going to put you on ACE inhibitors. Because you know diuretics or thiazide can worsen the diabetes. So you are going to shift him to the ACE inhibitor and open the BNF again for side effect for the ACE inhibitor. One good thing is that in the BNF also you can find which drug to shift on. It is written in section of hypertension, managing the hypertension, above 55 years old. So you can see from the BNF which drug to shift on. However, it will be really time consuming to check the BNF 3 times in the station. So it's better here to know that from amlodipine we shift to diuretics, but since he's having diabetes or she's having diabetes, we shift her to the ACE inhibitor. And same in the previous station. Do we have to show the patient? Do we have to show the patient where side effect is written in the BNF? I don't prefer this because this will be really time consuming. You are sitting at least for a few centimeters from the patient, so you'll have to be closer to, or go closer to the patient to show side effects, and the font is very small. You will be concentrating with the patient on how to read the font and how to check the side effects. You will end up wasting much time. So you can tell him or her, excuse me for a moment, actually I checked my book and I found this and that and that. I got 12 in this station. So that's what I'm telling you to do. Don't worry, you do not need to be too particular in this because you know that it's really time wasting. So once you opened it once, it's very enough. Do not pretend. Better not pretend, because the examiner was sitting like beside me, actually. She was observing me. So what I need you to do is that you need to learn how to open the BNF. I mean, even in case. And it's very easy, by the way. Very, very easy. You can open it and you can check many things from it. Okay, okay. The Rrp has got 2 more stations as well. Yeah, do not pretend to the administrator with experience, but do not pretend anything. Do not actually. You know very well that some people cannot open the BNF. You know what happened to one of my friends? One of my friends, he said, I will check with my book. The examiner told him, okay, there's a BNF doctor. My friend looked at the examiner like in a bad way, like, okay, now I'm going to check my book. The thing is that my friend did not know how to use the BNF. He didn't know. That's why he didn't pass the station. Because the examiner insisted on him. So it can differ from one examiner to another. But the thing is that actually they are right. You need to open the BNF. It's very nice to open it. It will barely take you a few seconds and it will give you higher mark. You will definitely find the exact page. Why? Because everything is written in the index. You will be counseling the drug. So you find the drug itself written in the index. You will find it definitely in the index. In the only case that you cannot miss is that maybe in the next one of the next dishes, which is the pregnancy, the blood pressure medication in pregnancy. In this way, you will need to open the section of pregnancy, not the section of hypertension. Sorry, the section of hypertension, not the section of pregnancy. And when you are opening the BNF in systematic way, that's why I recommended that you always open the BNF that I sent you to the group. Open the BNF to learn how to open it. You will find the index, the alphabetic index in the ends, and the systematic index in the beginning. In systematic index, we use it for 3 or 4 stations. 3 or 4 stations only a systematic index. Wait for a minute. Systematic and alphabetic index. The systematic index, you can use it only in 3 stations. Number 1, the UTI, in which you should write a prescription. Number 2 as well in the hypertension in pregnancy. Hypertension in pregnancy is very important. Okay, so hypertension in pregnancy and UTI, in which you should write a prescription. Okay, there was also one more station. The infection is sepsis. Sepsis station, you can also use the BNF after telling the examiner, I will prescribe IV, amoxiclav, and clarithromycin. So 3 stations: sepsis, UTI prescription, and hypertension in pregnancy. Okay.
Hello, Dr.
So
Ahmed.
yeah.
Okay, in my day, there was a station like citalopram induced maybe
Tiredness.
Tiredness, yes.
Yeah, this station actually will be. This is one of the stations that are missed, and the station that I was supposed to record and send you all. This is together with 5 more stations are missing. I was supposed to send them to you in recording.
Okay.
Tell me.
Stations.
Yeah.
Okay, in the stations, actually, I was trying to find out citalopram, but I knew it was not written in citalopram. It was written in SSRI section.
Yeah.
Okay. And then I tried to find SSRI, but when I searched the index, the SSRI, the page number just next to SSRI, I mistakenly wrote something before SSRI or after SSRI page number, and then I went to that page and I didn't find anything. Like I found something like insulin or something else. I don't know why. Like sulfonyl urease, I found this. And unfortunately, I have to say to my patient, excuse me, at this point I can't find the exact page, but after our discussion I will find out. I told my like simulator up to this. But should I search it again or search it for the second time?
No. Yeah, at this point you say that actually the tiredness is due to the medications that you are taking. However, I will confirm with my book as well.
Yes, I told this.
Yeah.
But is there any problem if I fail to found such pages?
Yeah, you can be in trouble. Because it shows that you cannot use a BNF. This is not good.
Okay.
You will be looking very awkward if this ever happens.
Yes, but fortunately I passed. I don't know why.
Yeah, I mean, how did you pass it?
Okay, I passed because my history taking 3, management 2, and my interpersonal 2 is 7.
Okay, very good. But what happens? Yes, he gave you 2 in the management. So I'm sure that you said everything in the management, maybe.
Yes, I told, and after that I told, okay, as far as I know that citalopram is one of the drug of SSRI group, and SSRI has a side effect of as a renowned side effect of tiredness. But I will also confirm this with my book later, and I will also discuss with my senior. I told this.
Very good.
But after failing to find out the page.
Yeah, you wasted much time.
I got to. Sorry?
You wasted much time.
Yes, I wasted a lot of time. Okay, but next time I will find out every page.
No, I will find it to you right now. I will find it after the session. I will discuss it, the BNF with you. I mean, I will show you guys how to open such things in the BNF. I will I will do it myself and I will send you right now after the session on the WhatsApp group.
Okay, thank you.
Because it sometimes can be challenging for you. That's a good point. Okay, next station is another run pill station in which the patient is trying to be pregnant and she is taking Ramipril. Your history taking should be very similar to it, and she is having hypertension. Before anyone is going to pregnant, so you will only add 2 or 3 questions in this station, which are the UTI questions, or sorry, the STI question. Why? Because this is pre-pregnancy or pre-conception counseling. So in any pre-conception counseling, you need to ask about some symptoms of STI, like do you have any bleeding, or do you have any discharge or swelling in your front passage or your private part. This is written up. I mean, it's very similar to the previous stations, like in terms of hypertension and drugs and such things. But just add 2 questions in the past medical history about the STIs, because this is pre-counseling or pre-conception counseling. Okay, now move to the management, guys, or now move to the examination. Do not forget to always examine the tummy here. Move to the management. In the Ramipril, it cannot be taken in pregnancy because usually it can cause some teratogenicity. So what you are going to do, you are going to change it to another group of drugs. Which drug? Let me open the BNF right now. Now, you will not open the BNF from the alphabet. You will open it from the systematic, from the beginning. So you are going to open the BNF from the hypertension, the cardiovascular system, section hypertension. You will find it in section hypertension that hypertension in pregnancy should be managed by alpha-methyl dopa or labetalol. Any of them can go. Central acting antihypertensive. Okay, what else should I do, doctor? If she asks you about side effects, you'll definitely open the BNF. It's written in the BNF under it, side effects. What should I do else? This is preconception counseling. Don't forget that it is not only drug counseling. Preconception means that you also need to advise her about what to do in pregnancy. You will advise her if she smokes to stop smoking. Healthy, balanced diet to maintain good weight. Proper physical activity. Abstain from alcohol. This is lifestyle advice. And you can prescribe her some supplements like folic acid supplements, some calcium and vitamin D supplements. So you will prescribe her these things: folic acid and vitamin D supplements. Folic acid and vitamin D supplements. You will prescribe it to her. Okay? This is the preconception counseling. It's very simple station. But they just brought it for one reason, to open the BNF. Because not all of you know that the labetalol is a safe drug in the pregnancy. Both of them can be prescribed, either alpha-methyl dopa or labetalol, by the way. But just open the BNF. Okay. Similar station, definitely similar to the past one. And by the way, you can also take some sexual history here. Like, for example, are you sexually active? But definitely this may look awkward because she's already coming, she needs to be pregnant. So definitely she is sexually active. So definitely it's like Rrp station, the previous one, but just you need to ask some STIs question. And you'll change the medication into alpha-methyl dopa or labetalol, and you'll check the BNF to see the side effects. You will advise her about healthy, balanced diet and proper lifestyle advice before pregnancy, and you will advise her, or you give her some folic acid and vitamin D and calcium supplements, or better vitamin D alone. And vitamin D can be supplied from the sunlight, okay? But we also give supplements. Okay. Next station is Ramipril, but the Ramipril here, this guy has got some different complaint a little bit. What is a different complaint here? And that this guy has low GFR, low glomerular filtration rate after the Ramipril. This is a problem actually. Why? Because this is one of the side effects of the Ramipril. So one of the side effects of the ramipril is that it reduces the GFR. However, it was mildly reduced here. So you need to run further investigations. Give me a minute, guys. By the way, we are finishing in 15 or 20 minutes. Okay? So just give me 1 minute. Okay, guys. So it is very similar station to the previous ramipril, but here instead of asking about the cough, you need to ask here about the symptoms of kidney function, low kidney function. When someone is having low GFR, we need to ask about the relevant kidney symptoms, like for example, you can here ask about any leg swelling, any nausea, any vomiting, any tiredness. Those are the questions. So you need to add these questions. So in the previous station, symptoms of STI, here you need to ask about symptoms of kidney malfunction. Again, past medical history, lifestyle, examinations. After that, disclose. The test results show that actually it is a test result. So you will tell him that the test results show that the kidney function were low. Why your kidney was not functioning properly? Actually, this can be having many reasons, but unfortunately, one of them is the side effect of the drug you have been prescribed. However, I'm going to confirm with my book right now. Open the BNF right now, you'll find that sometimes it can cause some kidney dysfunction or low GFR, low kidney function, or decline in kidney function. What are you going to do right now? You are in GP, by the way. You are going to refer him to specialists. First of all, you are going to refer him to specialists for further investigations. Like what? You will repeat the kidney function test for him again after some time. And they can perform some scans, some urine samples, sorry. So, number one, they repeat the kidney function. Number two, they will do some urine analysis. Okay. Number three, they can do ultrasound on the kidney. Those are the three tests that should be done by the specialist. Okay. And you may consider reviewing his medication and putting him on different group of medications. If he ever asks you which medication you are going to give, you can say calcium channel blocker. Calcium channel blocker. Okay? Okay. But he will not ask you. You just say you are going to review your medication and definitely we can change it for you. If he ever asks you, doctor, so if I develop this, you could give me the wrong medication, you will tell him that actually this is one of the best medications. However, every medication has got some side effects. That's why we always follow our patient and we do this test for them. And I'm glad that you came today for us for the review. So again, you may need to stop and review the medication with your senior, and you can refer him to kidney specialist to perform further investigations, some kidney function test again, and some urine analysis and some ultrasound in the kidney, okay, to make sure that everything is fine. That's it. This is the station so far. Has anyone got any problem here? The only difference is that you should ask about some kidney problems, like the leg swelling and tiredness and nausea and vomiting. So in the cough station, you ask about the cough and the phlegm with blood. Here in this station, you ask about maybe the kidney malfunction symptoms. Anyone has any problem so far? Anyone has any problem? Okay. Let's move to one more station. Actually, the blood pressure stations are quite interesting. Okay, the blood pressure diagnosis station, there is a counseling station which are FY2 in GP. The patient has been diagnosed with blood pressure. This is now the diagnosis of blood pressure is confirmed and the Q risk is 14%. 18%, sorry. The Q risk is 18%. So his reading was high. Nurse colleague have measured it for the third time. His reading was high and he is diagnosed right now with blood pressure. This is the first diagnosis of blood pressure and his Q risk is high. So this is the first diagnosis of blood pressure and the Q risk is high. Talk to him and manage his blood pressure accordingly and advise him. Special note none. Now he has come for the checkup, regular checkup, and part of the checkup is measuring the blood pressure, right? When you speak to him, you will tell him, how can I help you? I came for my checkup. That's great. Now ask him, any reason? He will tell you, like what, doctor, do you have any symptoms? Sometimes he can give you some headache, some blurry vision, some heart racing. Even if he did not give you anything, you know from the task that he is having high blood pressure. So you need to ask about some symptoms of hypertension. Okay? This is number one. Number two, ask him about any heart or kidney problems or any stroke, because these are complications of hypertension. Take some past medical history. You can find that he is having high cholesterol as well. Family history, heart problem. Lifestyle messed up, definitely. Stress, yes, he's stressed. Now move to the examination, including the BMI. BMI, do not forget the BMI in any hypertension. BMI is high as well. So you will disclose to him, you will tell him that part of your review, we have measured your blood pressure and it was a bit on the higher side. So this means that you're having a condition called hypertension. What is this, doctor? The blood pressure, which is the flow or the pressure of the flow of the blood inside our blood vessels, is high, which causes some damages to the blood vessel, like stiffness or rigidity in the wall of the blood vessel, which can lead to some further complications by time. Why did I develop it? You will tell to him many reasons. Number one, family history. Number two, the cholesterol that you're having. Lifestyle as well, including smoking, could be a reason. Like any hypertension. Okay. How can I manage it, doctor? Wait. Actually, one important thing is that this guy is having also high BMI and high Q risk. So you told him about the hypertension. Number two, tell him actually that also you measured your weight in relationship to your height, which showed that it was on the higher side. This could be also one of the reasons which can worsen the hypertension or can bring the hypertension. This is the second thing. Third thing, you will tell him that we managed your Q risk. We measured your Q risk. What is the Q risk? Q risk is a measurement which is said to determine the risk of this patient developing hypertension, or sorry, the risk of this patient developing cardiovascular problems in the next 10 years in a population of 100 people. For example, if this patient together, his Q risk is 18%, which means that among 100 people, he and the other 18 people, or he and the other 17 people, sorry, are at risk of developing cardiovascular disease. So the Q risk is a measurement to assess the cardiovascular or the liability or the possibility of developing cardiovascular disease. How? The Q risk, again, it is a measurement to see the measurement or the percentage of developing cardiovascular disease among the population of 100. This means that you and other 17 people among a population of 100 are liable to develop the cardiovascular complications like stroke or heart problem. Okay, so what can I do? So now we disclose 3 things. Number 1, hypertension. Number 2, BMI. Number 3, Q risk. Which are the findings in your task? What can I do? There are some things that we can do and some other things that you can do. What you can do, doctor? Oh, sorry, he will ask you what I can do. You will advise about the lifestyle, diet, smoking, alcohol, physical activity, and stress. What you can do to me, doctor? We can prescribe you medication. No, I don't need medications, doctor. May I know why? Doctor, I don't want to take medications. I'm clear. Now you will tell him that, do you know why you should prescribe medications? Why, doctor? Because your blood pressure reading was a bit high. And actually, your reading will be more likely controlled under blood pressure medication. Doctor, I don't care. Do anything, but do not give me medications. Do you know what will happen if we do not prescribe medications? What will happen, doctor? Now you can tell him about the complications of hypertension, like cardiovascular problems, like heart problem, like some stroke. Okay, those are the things. Also, he is having high cholesterol, which puts him under more risk of that. Which medication, doctor, are you going to give me? I will discuss with my senior and we can prescribe you 1 or 2 medications for your high blood pressure, and we are going to review you. But doctor, do they have any side effects? You will tell him that usually they are safe. However, as any medications, it could be having some side effects. For that, we are going to follow you up regularly. Please don't worry about that. Okay? Okay. So this guy does not want to take any pills. That's it. So you will warn number 1 about benefits, number 2, complications, number 3, follow-up. So this station is lifestyle and medications. This is a whole station. There is a new station which came just 2 weeks back. There was a guy who just, this is the 2nd reading of high blood pressure, and he is having Q risk of 9%. So the Q risk is not high, and it is only the 2nd reading of high blood pressure. So here, in the management, you will not give medications. You will give lifestyle advice, and you will offer him follow-up, like regular follow-up, because he needs to measure his blood pressure later on again. His blood pressure was 142 over 110, or over 112, which means that his blood pressure was high. So you will tell him that he is liable to get hypertension, and I think he was also having high cholesterol. So only in this station, the difference is that you will not give medications. You will only advise about lifestyle. In the end, you can tell him, however, if your blood pressure is persistently high, we may consider giving you some medication. That's it. But in the previous station, you have to give him medication because his blood pressure is confirmed to be high right now for many occasions, and also the Q risk is high. Okay. Anyone has any questions so far? We will discuss the last 2 stations for today, the dementia and the stroke. And the needle stick, we'll discuss it tomorrow. Tomorrow we'll be having only 15 stations. So tomorrow is sort of break. Are you happy, guys? I bet you are. So, okay, so guys, when someone is coming at risk of stroke, Dr. Yasmin, tell me, if I'm coming to you, doctor, I'm really worried, I'm here for my checkup, and I need to know if I'm at risk of stroke or not.
So first of all, I will encourage the patient that Mr. So-and-so, you did a good job that you came here to have a checkup.
Yeah.
Then why you think that you will get the stroke or not? May I ask few questions from you?
Perfect. Doctor, I'm worried about stroke because I think, you know, my aunt has a blood stroke as well. And I saw her life is like, her life is affected, doctor. I don't want this to happen to me.
I'm really sorry about your uncle and aunt situation, but don't worry, we are all here to help you out. I need to check the risk factors which can lead to the high, like stroke chances. So may I ask you about your general health?
Yeah,
How is your?
perfect. Doctor, my health is fine. Tell me.
Could you please tell me about your blood pressure status? When did you have a check for the blood pressure?
Okay, wait, Dr. Yasmin. When someone is coming for the risk of developing something, you need to ask about the relevant symptoms of the thing.
Okay.
For example, have you developed any weakness, any problem with your speech? Before going for anything. This is number one symptoms of relevant condition. Number two, ask the past medical history that you wish. Like, for example, do you have any high blood pressure, any high cholesterol, any do you have any TIA or transient ischemic attack in the past? Do you have any heart problem, any kidney problem? Like this.
Yes.
What's next?
After that past medical history, I have asked in the past medical history, any history of then any medications you are taking?
Yeah,
are you allergic to any medicine? Then family history, anyone in the family having history of stroke or heart problem?
Perfect.
Then lifestyle.
Lifestyle is a core here, by the way. Yeah, okay. She's having hypertension, and she's having messed up lifestyle.
Okay.
Move to the examination, Dr. Yasmin. What will you do in the examinations?
So move to the examination here. I will say that I will take the general physical examination and especially checking blood pressure, and then neurological examination, including muscles.
Perfect.
Power.
But you forgot one important thing, Dr. Yasmin, and I will kill you right now.
Vitals.
No, one thing. Can anyone tell me what did she forget? BMI. BMI is very important.
Yeah, BMI is very important here.
In any cardiovascular problem, Dr. Yasmin, please do not forget to mention the BMI because it's very important. This is the core of the session sometimes.
Yes, you're right.
Okay, so she is having high BMI, Dr. Yasmin, and her blood pressure was a bit on the higher side, and you know from the lifestyle that it's messed up. So disclose to her.
Yeah, so for the disclosure, I will say that Mr. So-and-so, thank you very much for the history and providing me the opportunity of examination. After getting all these, I found that your like body mass index is high. Do you know about that? What is body mass index?
No, Dr. Tell me.
Okay, so this is a relation between your weight and height. Okay. So according to your age group and height, it is much more, which can lead to different cardiovascular problems, like problem to like stroke or heart attack. So secondly, I found that there are certain, lifestyle habits.
Dr. Yasmin, why didn't you simply start your management by saying, from my assessment, it seems that you are unfortunately at high risk of developing stroke?
Oh, okay. Yeah.
Disclose the concern first. After that, say anything you wish. When I ask you why, say what you are going to say right now.
So unfortunately, after reviewing the findings, you are on the you have more risk of having stroke. Then I will give the pause.
Yeah, exactly. Why, Doctor?
Yeah. Okay. As I said, that your BMI is more than like for example, more than 25. Yeah. Secondly, you have certain risk factors positive in your lifestyle. For example, you are smoking, you are taking alcohol this much, or your family has a strong positive family history of heart problem, your dietary habits, your stress in your life, all those positive things which I will get from the history, like stress,
Exactly.
physically inactivity, those things I will add up and then I will say that due to these reasons.
Okay,
You
perfect.
have,
What's next,
yeah.
Dr. Yasmin?
After that, I will say that, but there are management plans, which some of them you can work on that and some of them we can, okay? What
Perfect.
you would like to be, what
Perfect.
you would like to discuss first?
Doctor, tell me about what you can do for me.
Okay, so here as it is you have high blood pressure, it is very important to start blood pressure medicine regularly.
Okay, doctor, I'm taking the blood pressure medication, but not regularly. For example, he give you in the history irregular intake.
Yeah, so it is very important to be adhere with the BP medicine.
Exactly.
So, for example, if you are not taking, you need to take it on a regular basis and have a blood pressure checkup on a regular basis. Okay.
Exactly.
Then, secondly, other medicine related issues. Secondly, I will give some preventive medicines to you. Okay.
Okay, perfect. Which medications, doctor?
Mini aspirin that is coming in the strength of 80 milligram. I will give that medicine to start to take once in a day.
Okay, perfect. So what you can do, Dr. Yasmin, here in this station simply is to give medications that you can do and follow up his hypertension and his cholesterol and kidney function and blood sugar. This is what you can do. And what he can do, or what she can do, lifestyle, smoking, diet, alcohol, physical activity, and stress.
Yeah,
So what
whatever
exactly.
week I will find, then I will talk about that, not all. I can't cover that.
Exactly, perfect. That's what I'm always telling to the people, that you do not need to cover everything. You don't need only to cover what you pick up from the history.
And then check the understanding and commitment, how he is taking it, he is taking. Are you ready for that? What do you think about that? You would be able to do this like this. If you want help regarding diet control or exercise, accordingly, I will refer the patient. If I believe it is difficult, but you know what, I can refer you to the instructor, gym instructor will guide you what exercise will burn the calories in a faster pattern. Okay.
Okay, Dr. Yasmin, I have a good idea. Why don't you give him in the end, if you develop any weakness or any slurred speech or any facial problem, come back to us.
Definitely, that would be in the safety netting and warning sign part.
So now, guys, you see what is the safety netting and warning signs? You're having time to say them. Safety net warning signs are that if you develop these symptoms of stroke, come back to us. Safety netting is that you should take your medications regularly and follow up with the lifestyle, because the risk of stroke is higher in case of your lifestyle and your body mass index.
Yes.
So what
by the way, we have to reach by the follow-up and safety netting. It is important here because blood pressure is already high. So in the follow-up, you will say that I want to see you within 2 weeks of time, that your BP, how your BP is under controlling or not.
Yeah.
Because you know, like, but in the meantime, if you feel any time that you are getting any weakness in any body part or numbness or slurred speech, like fast, FAST, fast.
Yeah, exactly.
Any facial sign of weakness, difficulty in speaking, or then immediately you don't need to wait for another 2 weeks. You should report to us.
Exactly. That's perfect. So here in this case, guys, some things that we can do and some other things that, okay, Dr. Samia, no problem. We are already finished. We are left only with one station, which is quite similar to the stroke, the vascular dementia. So here, the warning sign, or here what you can do, something that we can do and some other things that you can do. What we can do, we can give him some medication like mini aspirin, if you wish, blood thinner, if he's at high risk of developing stroke, which is already he is. And we are going to follow him up in terms of his kidney function and cholesterol and blood sugar as well. What he can do, he can, number one, take the blood pressure medication or take his medications regularly generally. Number two, do lifestyle advices or do lifestyle changes. In the end, you're going to offer him some safety netting and warning signs. Last station for today, and it came to me. The lady who's worried about dementia. Again, similar to the stroke exactly. She's worried about dementia. Do you have any idea why she's worried about dementia? Because her mother developed dementia. And she doesn't want it to happen to her. So what you are going to do, you're going to ask her, do you know what dementia is? Doctor, it is memory loss. Now explain the dementia to her that it is a condition in which there is a decline in the brain function. Gradual progressive decline in the brain function. Again, gradual progressive decline in the brain function. Okay? So now, for this, I'm going to ask you a few questions if you don't mind. Have you developed any problem with the memory? See, number one, I'm asking some symptoms about the relevant concern. Memory problems, concentration problem, difficulty in understanding. 2 or 3 symptoms are very enough. Now move to the past medical history. You will find that she is having high cholesterol, she is having high blood pressure sometimes, she is having many things. Okay? Lifestyle, very important. Stress, also very important. In the examinations, what you are going to do, Dr. Muniba, in the examinations, tell me what to mention in the examinations.
We'll mention the vitals, including blood pressure and BMI and general physical examination.
BMI. That's what I wanted to hear from you. This lady is having high BMI.
Yeah, 32.
Yeah, bravo. So she's having high BMI and it's quite high really. So we need to do some investigations as well. If ever the examiner asks you, like in this station or in the previous station, you will say we need to do some routine blood and urine, some routine blood test and ECG as well. Routine blood test and ECG, like full blood count, kidney and liver function test, and blood cholesterol and blood sugar. Okay. Now disclose. You are at high risk of developing a condition we call stroke. What is this, doctor? You will explain the stroke to her. Disruption in the blood supply of the brain. Doctor, but what about dementia? Actually, this is one of the risk factors of developing dementia. We call vascular dementia. Do you know what is this? So we told her that she is at high risk of stroke, which brings her to risk of dementia. Now, tell her that vascular dementia is a dementia due to the disruption in the blood supply to the brain. Gradual disruption in the blood supply of the brain, which leads to gradual progressive decline in the brain function. Why do I have high risk, doctor? From the history. Number one, high BMI. Number two, hypertension and high cholesterol. Number three, smoking and diet and alcohol. How can we tackle this? There are some things that you can do and some other things that we can do. What would you like me to start with? And it is very similar to the stroke. It is almost the same to the stroke. But in the warning signs you are going to give her, if you develop any memory problem, which is increasing by time, come back to us. This is the station simply. So here the disclosure is that you are at high risk of developing stroke, which puts you on high risk of developing dementia. How? It is called vascular dementia. Now you can disclose the reasons and the findings. Today we did not discuss 2 stations of the counseling and the infective endocarditis. I think that this station is cursed, together with the station of the confused man with SIAD. So what I'm going to do, I'm going to record the SIAD station, and the infective endocarditis I will bring Dr. who? Dr. Yemi. Dr. Yemi, you are the one who is going to perform the infective endocarditis station with me tomorrow before the session, 10 minutes before the session. Yes, I think we'll start a little bit later because Dr. Yemi will practice the infective endocarditis with me before the session. Dr. Yemi, do not escape.
Dr. Ahmed.
Yes, okay, tell me.
Yeah, when? 10 minutes before the session?
Yeah, 10 or 15 minutes before the session.
Okay, that's tomorrow.
Yeah, inshallah.
Okay, no problem.
Okay, so Dr. Yemi will practice the infective endocarditis station with me. After that, we'll move to the remaining counseling stations. We'll discuss only 15 sessions tomorrow. And they are almost similar to each other. 2 needle stick and 4 or 5 diabetes stations. And warfarin, three warfarin stations or 2 warfarin stations. Okay. Besides some other simple stations as well from the counseling, like the endoscopy and some other things. I believe that we can finish the counseling tomorrow. But let's see what we can do. Counseling are very easy and they are almost very similar to each other. Okay, so thank you guys for listening today. Take care, you all, please. Have a good night's sleep, especially Dr. Masih. Yeah, I know. This is your sleeping time, Dr. Masih. It's almost 12:30 there. You sleep from 12:30 till 1:30, and then you wake up the whole night. Sleep well, man. Sleep well. Don't lose sleep for this exam. Okay? So, by the way, guys, have you started practicing or not? Do you practice or not? Do you guys practice or not? Who here does not practice? Tell me honestly, don't be shy. Who here, apart from Dr. Maria, of course, who just passed PLAB 1 yesterday?
Well, I'm trying to practice.
You're trying, you have to, but still, you're having long time. You're having like at least more than 2 months to do that. Dr. Yasmin, I know that you do practice. Dr. Manisha, what about you? Do you practice? Yes, I am. Are you sure? Are you sure, Dr. Manisha? Dr. Manisha?
Yes, I am here. Yeah, we do practice some days.
Some days, yeah? Like twice per week. Yeah, like twice per week, maybe. Be honest. Don't lie. Tell me.
Yeah, that's why I said like some days, to be honest with you.
I picked up the right person.
Yeah.
Okay, Dr. Manisha. When is your exam, Dr. Manisha?
It's on June 13.
Oh, you still have that much time. More than 1 month and 2 weeks. More than that.
Yeah.
Dr. Islam, how about you? When is your exam? May. You still have time as well. You still have more than 3 weeks. Did you start practice or not? Why not? You have to start practice as soon as possible. You are going to wait. Let me stop the recording. You are going